Good morning, everyone, and welcome to the fifth meeting on the Joint Interim Standing Committee on Growth and Infrastructure for the 2023-2024 interim. Today is a special meeting for the committee as we are hosting a joint meeting with the Joint Interim Standing Committee on Health and Human Services. Can we have the secretary please call the roll?
Senator Daly.
Here.
Senator Hansen.
Here.
Senator Wynn. Here. Senator Titus.
Here.
Assemblywoman Brown May.
Here.
Assemblyman Carter.
Present.
Assemblywoman Dickman.
Here.
Assemblywoman Gallant. Assemblyman Gray. Assemblyman Hibbets.
Here.
Assemblyman Wynn. Here. Assemblyman Orentlicker.
Here.
Assemblyman Watts.
Here.
Chair Donyate.
Here.
Chair Harris.
Here. And can you please mark Assemblywoman Gallant absent excused? And if anyone happens to arrive during the course of the meeting, please mark them present. As we begin the meeting today, I'd like to extend a warm welcome to the members of the Joint Interim Standing Committee on Health and Human Services, as well as acknowledge the efforts made by its chair, Senator Donyate, to work with me and identify areas of focus for our two committees. Today's meeting acknowledges the intersection that exists between the infrastructure of our communities and the health of the people who live and work in our state, both north and south, in urban and rural locations, as well as those who make Nevada their destination for travel and recreation. Key issues that we will be addressing today include traffic safety, pedestrian safety, the Complete Streets program and initiatives, and efforts to mitigate excessive heat in the urban environment. Also, we'll receive an update on the Healthy Homes program. With that, I'd like to ask Chair Donyate, Chair of the Joint Interim Standing Committee on Health and Human Services, to share any remarks that he may have.
Thank you so much, Chair Harris. It's an honor, of course, to be back in Carson City to see everyone. I'm very grateful for our efforts to collaborate for this meeting. I think sometimes when we think of healthcare and growth and infrastructure, you probably don't see a lot of synergy, but I think this is probably a good example of how public health can extend to other factors of our daily living. And so very excited to talk about how we can improve the lives of our community, and excited for the committee members to engage in these conversations. So thank you.
Thank you, Chair Donyate. Before we begin today's presentations, I just want to go over a few housekeeping items. Today's meeting is being held here in Carson City with the opportunity for community members to and presenters to attend the meeting virtually as well. Due to the relocation of the meeting rooms in Las Vegas, there's not a Las Vegas location for today's meeting. Committee members, if attending virtually, please keep your video on during the meeting to ensure we have a quorum, and be sure to mute your microphone when you're not speaking to minimize background noise. Of course, if you need to get up or need a break, please go ahead and turn your camera off. All presenters are asked to turn on their microphones before they begin their presentation. If committee members should have any questions during or after your presentation, please identify yourself each time you respond to a question. This assists our secretary in completing the minutes for the meeting. Where possible, materials for today's meeting are provided electronically. Anyone who'd like to access our meeting materials may find them on the committee's webpage or by contacting the research division. Anyone who'd like to receive electronic notification of and access to the committee's agendas, minutes, and final report can do so by signing up on the Nevada Legislature's website. I would one more time like to mention that the solicitation of recommendations memorandum and related information has been uploaded to the Growth and Infrastructure Committee webpage. This memo asks all interested parties to submit recommendations to us for potential legislation. The Joint Interim Standing Committee on Growth and Infrastructure may request up to 10 bill drafts, and I encourage all members of the committee, as well as individuals and organizations, to bring forward recommendations on possible legislation by July 31st, 2024. That is almost right around the corner, July 31st, 2024. We will now move on to public comment. Public comment will be limited to 2 minutes per speaker. An additional opportunity to make public comment will be available at the end of the meeting. You may provide public comment in person in either Carson City or via telephone at the number that is posted on today's agenda. Is there anyone here in Carson City who would like to provide public comment? Okay, looks like we have a taker.
Good morning, Chairs Harris, Doniate, and committee members. My name is Nick Shepak, S-H-E-P-A-C-K, and I am the Nevada State Director of the Fines and Fees Justice Center. FFJC is pleased to see that the conversation on traffic safety continues during this interim. I've had an opportunity to review the materials, and many of the findings, while unsurprising, are deeply concerning. They are concerning not only because they show a clear disparate impact on low-income and BIPOC communities, but because the top priority of the zero fatality slides remains automated traffic enforcement, a policy which in nearly every case actively and aggressively extracts wealth from communities. According to the data, it appears clear that our most dangerous streets exist in our most under-resourced communities. The same communities that were originally built often had the worst infrastructure and today often receive infrastructure updates last. If we are to use safety data to identify locations for ATE, it is hard to understand how these cameras would not be placed disproportionately in these communities. On the other hand, infrastructure solutions like we see in the Complete Streets program and in cities like Hoboken, New Jersey, who have gone 7 years without a traffic fatality, invest in these communities in ways that promote public health and public safety by increasing the public's ability to safely walk, ride bikes, access public transit, while also increasing green spaces. When addressing safety for marginalized communities, investment, not wealth extraction, has proven time and time again to provide better safety results, increase community trust in the government, and improve overall public health. On top of this, our current traffic enforcement system fails to hold higher income drivers responsible for dangerous driving, while at the same time levying harsh punishments on low-income drivers for minor infractions. We should be looking to fix our current traffic enforcement system before implementing a new one. We look forward to continued conversations with all stakeholders and today's presentations. Thank you very much.
Thank you.
Thank you. Good morning, Chair Harris and Chair Doniate. My name is Olivia Tanager, and I'm the Executive Director of the Sierra Club Toyabe chapter. The Toyabe chapter believes that we all have the right to a livable planet, and we work on supporting equitable renewable energy, increasing access to public transportation, and protecting and conserving the land, water, and wildlife in our region. We represent 40,000 members and supporters, and as such, are the largest grassroots environmental group in the state. To growth and infrastructure, you all will be seeing some SOR recommendations from us shortly, based on conversations and support from our large membership. We encourage you all to heavily consider the proposals and believe that they all have the potential to positively impact the day-to-day lives of people across the state of Nevada. We're recommending legislation on reporting and fair, clean energy considerations. We are recommending legislation that would allow for increased transparency and shut off due to non-payment, allowing for aid providers to better assist and help prevent folks' lights from being shut off. And we are recommending support of agrivoltaics. I look forward to working with you all on these proposals, and our members wanted me to relay that they are counting on you, and they look forward to supporting you and these proposals in 2025. In terms of the items on today's agenda, we unequivocally support efforts that make it easier for folks to move around without needing to use a single occupancy vehicle. We need to continue to improve walkable and bikeable infrastructure in the state and support our friends in the transit authorities who are working to expand public transportation access in Washoe County and Southern Nevada. We also must continue to mitigate the urban heat island effect and its disproportionate impact on low income and communities of color in the state. Thank you for your support and consideration of these issues.
Good morning, Chairs Harris and Janyate and committee members. Stephen Hamili from the Nevada Solar Association. We're an association of 6 current like-minded solar companies grounded and founded in the state of Nevada, some of us operating since 2007. We are also representing today Kirsten Stasio from the Nevada Clean Energy Fund and Solar for All. Our concerns today are what's taking place in the PUC with regards to the interconnection charge being increased, but most importantly, the potential threat against net metering. As we know, during the Inflation Reduction Act did two things for us. It legitimized solar so that the average household individual would feel comfortable with purchasing solar, but it also legitimized the solar industry with regards to worker base, creating thousands of jobs across America and over 1,000 jobs here in the state of Nevada. Our concern is that these jobs would be taken away with a potential change in net metering. But most importantly, the Inflation Reduction Act was meant to bring solar to the doorstep of every Nevadan by creating tax credits. A tax credit alone will not provide for solar without proper net metering fees and low interconnection fees. Without these, you virtually paralyze the intent of the Inflation Reduction Act. The areas that are the consumers that are most affected are your low-income consumers, where $2 to $3 per month on their energy bill can make the difference between going solar or staying with fossil-burning fuels. And many of them just continue to move forward and are impacted. They cannot use the tax credit. So what really is important to them is the interconnection fee and also the basis for a low and reasonable net metering. As we know, the fastest heating state or the fastest heating city in America, Reno, Nevada. Number 2, Las Vegas, Nevada. We owe our allegiance to Nevada homeowners to be able to move toward renewable energy and not to the shareholders of a investor-owned utility.
Mr. Hamili, you're
Yes.
at your 2 minutes, sir, if you could wrap up.
Thank you very much. I shall do so. So we're hoping for your support this year to assist us not only in maintaining the current net metering status that we have, but also to push forward more renewable and sustainable measures. Thank you.
Good morning, Chair Dunyate, Chair Harris, and members of the committee. My name is Tucker Desmond. I'm an intern at the UNR School of Public Health. In the past century, the field of public health has grown significantly with remarkable results. Between 1900 and 1999, life expectancy in the U.S. increased by 30 years. Of these 30 years, the CDC attributes 25 to public health advancements, that is, targeted initiatives to keeping communities safe and healthy. Public health initiatives not only improve the health of communities, they also bring substantial economic benefits, increasing workforce participation and productivity, reducing absenteeism, and reducing healthcare costs. However, despite its contribution to health and the economy, the field of public health is not often viewed or funded like other public goods and services, which are vital to the function and advancement of society and often fall to the government to supply. For instance, roads are widely accepted as public goods and funded by the government because they serve a fundamental role in society's function and yield large economic returns. Roads facilitate commerce, increase labor mobility and productivity, ensure access to critical services, and foster social cohesion. Similarly, streetlights, sidewalks, clean air, and parks all are public goods critical to the function and safety of communities. Ensuring pedestrians have well-lit places to walk, green spaces for recreation and exercise, and clean air to breathe all contribute to keeping communities safe and healthy, and are all public health interventions. Like roads, streetlights, clean air, and parks, many public health interventions are public goods that reap broad benefits. Immunization campaigns and clinics safeguard against disease and increase social mobility, social cohesion, and other productivity. Other core public health services, such as preventing and controlling infectious disease, preventing chronic disease and injury, and improving maternal, child, and family health, improve the health of communities and add significant economic value, but are inadequately or inefficiently provided by the market. As a result, it often falls to the government to establish robust programs, regulations, and initiatives to ensure such services are available. I want to thank this committee for acknowledging the connection between growth and infrastructure and the health of our communities. As a society, we recognize the importance of the government providing public goods for progress and improving quality of life, and it is important to recognize and fund public health like other public goods.
Okay. Oh, we've got one more here in Carson City. Please. There you go.
My name is August Lemaire, Lemaire. I live here in Reno, Nevada. My wife and I are retired and live on a fixed income. We have invested considerably in trying to reduce our energy needs, including building a home built with insulated concrete forms, putting rooftop solar on our roof for both hot water and for electricity. This has resulted in a lifestyle that we feel our investment can protect us from rate increases, and that as those rate increases happen, that because we have these energy conservation situations built into our lifestyle, that we can control our cost of living. The current proposal to increase the basic rate from $16.50 to $44 something is an unfair burden on people who are conserving and on people who are in a lower income bracket and just don't have the money to pay for, let's say, air conditioning, which is a huge bill. Net metering has been largely vilified by the utility as being an unfair load on the utility. The reality is that rooftop solar, which generates a good deal of electricity in the summertime during the heat, which decreases the need for additional infrastructure to carry the energy to and from those homes, is not only a good idea, but it's also very healthy for our planet. Really hope that this kind of proposal, which unfairly challenges people who have taken investments to rooftop solar, and also people who want to invest in it in the future. We need these kinds of initiatives and incentives to help to literally save our planet. Thank you.
Okay, broadcast and production services. Is there anyone on the phone lines who'd like to provide public comment today?
Thank you, Chair. If you would like to participate in public comment, please press *9 now to take your place in the queue. Caller with the last 3 digits of 918, please press *6 to unmute yourself. Thank you. Please continue.
Good morning, Chair Harris, Chair Dunyate, and members of both committees. My name is Leanne McAllister, and I am the Executive Director of the Nevada chapter of the American Academy of Pediatrics. Today, you will review data and policy options for 2 issues critical to the safety and well-being of Nevada's children: pedestrian safety and extreme heat. Usually, playing and exercising outside boosts a child's physical and mental health in many ways. However, a heat index at or above 90 degrees Fahrenheit poses a significant health risk. High temperatures and extreme heat can cause children to become sick very quickly in several ways. It can cause dehydration, heat exhaustion, heat cramps, and heat stroke, which is a medical emergency. High heat can also make everyone more irritable and impact mental health. Reno pediatrician Dr. Deb Hendrickson, and a member of our board, is a nationally recognized expert on this subject and recently published a book. She and I are at your disposal should you have any questions. On a good day in Nevada, when it's not dangerously hot and the air is clear of pollutants from wildfires, pediatricians strongly encourage all children to have at least 2 hours of exercise as prescribed in the HEAL Nevada 5210 program. Traditionally, pediatricians have encouraged families to have their children walk or bike to school as a routine form of daily exercise. However, in the United States, 16% of children killed in traffic crashes are pedestrians. The American Academy of Pediatrics calls for communities to adopt and promote policies, programs, and legislation that result in a safer environment for pedestrians. These policies are detailed in the links in my written testimony today. Thank you for your leadership.
Caller with the last 3 digits of 809, please continue.
Thank you. Good morning, Chair Harris, Chair Doñate, and committee members. My name is Melissa Ramos. I'm the Senior Manager of Clean Air Advocacy with the American Lung Association. Thank you for bringing forward this important discussion between health and transportation experts. These elements need to be better aligned in support of clean air for all communities. Land use and transportation planning decisions are health decisions, impacting how people move, whether they are bound to vehicle travel or have healthier, less polluting modes like walking, biking, or transit. We have some of the most polluted air in the nation, and transportation is a key source of that burden, especially in high-impacted communities, communities of color, or with lower incomes where access to good transportation options are often lacking. The American Lung Association State of the Air report revealed 95% of Nevadans live in a community with at least one failing air quality grade. And vulnerable communities, including kids, seniors, people with underlying health issues, are most at risk. People of color are also disproportionately exposed to unhealthy air and are more likely to be living with one or more chronic conditions that makes them more vulnerable to the health impacts of air pollution, including asthma, diabetes, and heart disease. We can protect the health of Nevadans by pivoting away from the combustion of harmful fossil fuels towards zero-emission technologies in the energy and transportation sectors. We need to see more great conversations between health and transportation planners to ensure that we're building a transportation system that moves us to a healthier, more sustainable future. You all have a role in informing the future health of our communities, and we want to be sure that this investment of time really does result in investments in a healthier, less polluting transportation system that serves all people regardless of income and access to personal vehicles. Thank you.
BPS, do
Chair,
we
you have
any-
no more callers wishing to participate at this time.
Lovely. Thank you so much. Okay, with that, I think we can roll straight into our presentations. Let's begin with the first one on the agenda today. That is a presentation on equity in traffic safety. We have representatives of the National Highway Traffic Safety Administration, which is a part of the United States Department of Transportation, who are presenting virtually. Yes, I believe we have Miss Bees, Miss Sowers, and Miss Schick.
Good morning. It's only me, Allison Bea, so I will share my screen if you can bear with me.
All right, great. Thank you so much.
So, good morning, everyone. My name is Allison Bass. I am a program data analyst with the National Highway Traffic Safety Administration, and today I will cover equity in traffic safety, more of a federal perspective, national perspective. Here's the content that I will cover for today on your screen. But first, I want to start with the executive order on advancing racial equity and support for underserved communities through the federal government. This is a foundational document that I want to highlight, and this order directs each federal agency to assess their programs and policies to identify and eliminate systemic barriers that hinder people of color and other underserved groups. By conducting these assessments, agencies can develop and implement policies that ensure equitable access to resources and benefits for all communities. Additionally, the order emphasizes the importance of creating new policies, regulations, or guidance documents when necessary to advance equity in all agency actions and programs. This initiative aims to foster a fair and inclusive environment where every individual has the opportunity to thrive. Important is to define equity and equity under this executive order, which is the consistent and systematic, fair, just, and impartial treatment of all individuals, including individuals who belong to underserved communities that have been denied such treatment, such as Black, Latino, Indigenous, and Native American persons, Asian Americans, and Pacific Islanders, and other persons of color, members of religious minorities, lesbian, gay, bisexual, transgender, and queer LGBTQ+ persons, persons with disabilities, persons who live in rural areas, persons otherwise adversely affected by persistent poverty or inequality. Here I want to show a depiction of equality versus equity. Under equality, everyone gets the same resource. As shown, some individuals cannot use the bikes because they have specialized needs. Under equity, the specific historical and present-day circumstances and abilities of individuals and communities are taken into consideration to provide appropriate solutions that provide everyone with opportunities to live safe and healthy lives. As you can see, there are different types of bikes, and there's adaptive bikes, specially designed to accommodate individuals with different physical abilities, such as, and include features like hand cycles. These adaptive bikes enable individuals with disabilities to enjoy cycling and maintain an active lifestyle. So they're able to enjoy that, the built infrastructure. This takes us to the history, zip code, and destiny, and exploring the impact. The environment you grow up can significantly impact your life trajectory. Recent research from the U.S. Census Bureau and top universities highlighted in the Opportunity Atlas, which is shown on your screen, show that neighborhoods can influence where you end up in life. This comprehensive database tracks the economic outcomes of children across different neighborhoods. It reveals that children growing up in disadvantaged areas are more likely to experience lower incomes, higher incarceration rates, and reduced educational attainment as adults. Unfortunately, many of these disadvantaged areas are historically affected by redlining. Redlining was a discriminatory practice that denied financial services to residents of certain areas, usually based on their race or ethnicity, leading to long-term disadvantages. Moreover, the Federal Highway Safety Act of 1956 further exacerbated these issues. While it was designed to improve vehicle mobility by creating an extensive network of highways, it often did so at the expensive price of pedestrian mobility, especially in urban areas. Highways were built through neighborhoods, dividing communities, restricting access to essential services, and decreasing the quality of life for residents. So this brings us to the concept of social determinants of health. Social determinants of health are conditions in the environment where people are born, where they're born and they live, learn, work, play, worship, and age. These conditions affect a wide range of health, functioning, and quality of life, and the outcomes and risk. The five are neighborhood and built environment, economic stability, education, access and quality, healthcare access and quality, and social and community context. For us, our main concern is access to transportation. So what does that look like? It looks like the following. You have infrastructure that was designed for vehicle mobility, but not pedestrian mobility. And as you can see on the screen, you have people with different needs, different mobility issues. You can see there's a young woman who's visually impaired, walking on a rural road without a sidewalk. An elderly lady where there's no sidewalk, an arterial road, vehicles traveling at high speed. It's a dangerous interaction. Older adults, Black, American Indian, Alaska Native people, and people walking in low-income communities tend to be disproportionately represented in fatal crashes involving people walking. According to Federal Highway, 8.6% of U.S. households do not have access to a vehicle. Lower income households were more likely to use public transit, walk, and bicycle for their travel. And in 2017, 8.5% of the population aged 5 or older had a travel limiting disability, an estimated 25.5 million people. And the top 3 medical devices used are walking canes, which is 36.7%, walkers 22.9%, and then wheelchairs 11.6%. There has been persistent overrepresentation. This is a study that NHTSA did from 2006. And in 2006, American Indians experienced the highest fatality rate per 100,000 population of 31.17. Then you can see white, it was 12.5, and then African American 12.31, Hispanic 12.27. This report also, there was a report covering 1999 to 2004, so we have like 17 years plus, and it's still that same trend where American Indian, I'll use the term AIAN, were disproportionately affected. And then also in terms of alcohol impaired driving fatalities from that time frame, American Indians and Hispanics had the highest percentage of driver fatalities who were alcohol impaired at 53% and 40% respectively. The overrepresentation still persists today. This is looking at our nation. We have approximately 109.5 million people living in disadvantaged situations. 35% of the census tracts are disadvantaged, and the total population was 329.8 at this time when we did use the data. So that overrepresentation still persists today, and this is the exposure to risk. This is the most recent data that we have from NHTSA in terms of race and ethnicity. And it's important to note that traffic fatality injury costs in 2020 were approximately $475 billion for the US. So this chart shows the traffic crashes per 100,000 population broken down by race and ethnicity, looking at the years from 2017 to 2021. And it's important to understand the proportion of risk. This chart illustrates how different groups bear different levels of risk when it comes to traffic fatalities. For example, the group represented by the orange line consistently has the highest fatality rate, indicating that they bear a higher risk compared to the other groups, which is AIAN group. The goal for NHTSA is lowering the risk across all groups. Ideally, we want these rates to be as low as possible and more equal across all groups, indicating that no particular group is disproportionately affected. So looking at trends over time, you notice how the lines change over time. Some groups show a decrease in risk, while others experience fluctuation or increases. So by studying these trends, we can identify which groups need more attention and resources to improve their safety and reduce risk. Then looking at other factors of risk. This is looking at unrestrained. And we can see the different types of vehicles. So we have passenger vehicles, passenger cars, light trucks, and we can continue to see that AIN continues to have the highest percentage of unrestrained. And so there is an opportunity there to improve safety. Then we continue to look at alcohol impaired driving fatalities by race and ethnicity. So we see that overall AIN people had the highest proportion of alcohol impaired driving fatalities in 2017 at 39%, and also in 2021 at 43%. And also looking at the raw numbers, we see the highest increase were Hispanic or Latino as an increase of 705, followed by Black or African American with an increase of 704 alcohol impaired driving fatalities. So it's important to notice what groups need our attention so we can tailor our interventions to meet the needs of these respective populations and to create culturally sensitive programming that really resonates with each community. Another risk factor is speed-related fatalities as well. So speed also plays a role. High driving speeds lead to higher collision speeds and thus severe injuries. Higher driving speeds also provide less time to process information and to act on it. And the braking distance is longer. So it's important to notice that here we have, before for 2017, it was Native Hawaiian Pacific Islanders. Now in 2021, our highest percentage is Hispanic Latino, and then also AIAN group. Then looking at overrepresentation by rural and urban, we can see that AIN and white individuals experience more traffic fatalities in rural areas compared to urban areas. By 2021, AIN individuals continue to have higher fatalities in rural areas, while other race ethnicities groups saw more traffic fatalities in urban areas. However, there are still groups such as Black or African American, Hispanic, or Latino who are affected by fatalities in urban areas. And then, so in terms of looking at what approaches the Department of Transportation, the National Highway Traffic Safety Administration is using to combat the overrepresentation. We were fortunate with the passing of the bipartisan infrastructure law that there was an influx of money, and that influx of money has also been funneled down to the states. And there are different strategies that we're using. It's a very holistic, and one of them is the National Roadway Strategy that is comprised of the Safe System approach. And one of the spokes is Safer People. And one of the things that is unique and is different now is that for the Safer People, our regulations also require for community engagement. So asking the community members of what type of interventions, what type of resources, programs they would like to see, how to bring them into resolving the issues because of the past mistakes with, let's say, like the other 1956 regulation. So this one is so to make sure that we don't do any harm. And so we want to make sure that people are part of that process and they are engaged. And that way we're also promoting responsible driving, responsible behavior in terms of just prioritizing everyone. And then we have the safer roads, more of that designing for also pedestrians and also the interactions, not before where it was just mostly designing for the vehicle and the movement of vehicles. And also safer vehicles, having more of that technology, what can we add to prevent crashes? And also thinking not only of the vehicle occupants, but also thinking of people that are aside of the vehicle and how they interact. And another important thing is safer speed, lowering that speed when there is those interactions. By lowering speed, then the danger and the injury is less, but at higher speeds, it can be fatal. So if there's that ability to lower speed, we encourage that. And then focusing on post-crash care, which is vital, and in terms of getting the individual to the adequate treatment facility, especially for people that are in underserved areas, rural areas where they might not have access to a trauma center or a healthcare facility because of lack of resources, making sure that the EMS is there in a timely manner and can get them to the adequate treatment so we can save lives. So that's really important. And within the Safe System approach, we have now 123 allies in action, 67 advocacy organizations, 29 private sector, and 27 governmental agencies, because we understand that we can't do this alone. It has to be a collaborative approach where all of us are working together in a synergistic manner to resolve these bigger issues that are not just within our silo, but interact with everyone. So this is, and also we've provided more funding. So in terms of investment in tribal transportation safety, also speed management, those are new initiatives that we haven't done so much in the past, but now it's a priority for this administration. So in terms of working together and using different approaches, more of that public health approach as well, we're seeing reductions from our latest numbers. And so from 2022 to 2023, now we're around, and these are estimate numbers, around 40,900, which is a minus 4%. So what we're seeing is a promising, we want to continue to see those reductions. And it's important for us to focus also as well on those overrepresented populations that have been affected by traffic fatalities for a long time. And before, there might have not been those resources, but now there are those additional resources where we can focus on those populations. And so looking at Nevada's traffic fatalities, and it's a high level. My counterparts, I believe, from the Nevada Highway Safety Office will go more in depth. It seems like the same trends looking at Nevada traffic fatalities per 100,000. AIN was 32.06, and then it followed by Black, African Americans, then white, and then Hispanic and Asian. Looking at pedestrians for the most recent, and just this is 1 year of data, it seems that Black, African Americans are overrepresented, and then you have Hispanic, white, and Asian. So, and also the pedestrian fatalities seem to be concentrated in underserved areas such as North Las Vegas, Paradise, Spring Valley, Reno, and Sparks. So in terms of the approach that the National Highway Traffic Safety Administration is using, it's much more of that integrated approach, that safe system approach, and bringing in partners and looking at different ways of how we can work together to resolve this issue, and also involving the community as an expert, because they are the expert and they've lived there, they know, they understand their infrastructure, and we should be respectful of their needs. So I want to thank all of you for your time.
No, thank you. I really appreciate you going into such detail and taking the time to present to us here in Nevada, although I know your duties are mostly on the federal level. Do the committee members have any questions? Okay, explained it so thoroughly. Committee members have no questions. I want to thank you again for your presentation and for your time. We'll go ahead and close out agenda item number 3 and open up agenda item number 4, which is an overview of Nevada road safety issues and community impacts. We have representatives of the Office of Traffic Safety. We have representatives of Nevada's Department of Transportation. And we have representatives, hopefully, of the Division of Public and Behavioral Health. I will let you all introduce yourselves as you begin. Starting with Ms. Davey.
Hi, good morning. This is Amy Davey. I'm the administrator of the Nevada Office of Traffic Safety, which is in the Department of Public Safety. And I'm joined by 2 colleagues today. We're bringing you a coordinated presentation. So when they get to their portions of the presentation, they'll, I'm sure, tell you a little bit more about themselves and their organization. But my 2 colleagues today with me are Lacey Tisler from Nevada Department of Transportation. She's the Chief Traffic Safety Engineer, and she's joining us via video conference because she is in Elko right now at Nevada's first Rural Road Safety Summit. And then to my left is Ms. Julia Peak from the Department of Health and Human Services, who also has a portion of our presentation. I think the presentation is up. Can you see it? Or, yeah, got it. Thank you. So you heard some good data and some good sort of overarching information about equity and traffic safety. We're here today to bring this down to a very personal level, a Nevada level, a level in our own communities, one that we believe you can impact and one that we believe that you can relate to. So in the next few slides, I'm going to provide a brief overview of roadway crash data with an emphasis on Nevada demographics and equity disparity issues that were touched on in the previous presentation. And then I'm going to turn the presentation over to my colleagues. The data that I'm using on these slides is from the National Highway Traffic Safety Administration, but it's specific to Nevada. The next few slides are data heavy, so while I will move rather quickly for the sake of time, I'm happy to provide follow-up or answer questions as opportunity allows. You heard referenced earlier the State Highway Safety Office, and that is the Nevada Office of Traffic Safety. We are the designated State Highway Safety Office for the state, and one of our responsibilities is to analyze crash data and to distribute this data to inform and support programs and policies that implement proven countermeasures to reduce fatal and serious injury crashes. It's likely that the most dangerous thing that any of us do today is walk, drive, or ride. And it's important to us that the transportation conversation go further than convenience and capacity. This is an introductory data slide that gives you an idea of what we're seeing on our roads in Nevada regarding safety. As you can see, we have experienced a significant increase statewide of 36% in a 4-year period for which we have final data. At the bottom of this slide, I've included a few trend lines related to specific issues or road user types, such as DUI, speeding, and vulnerable road users, all of which are also trending up. Our 2023 preliminary fatality number is around 390, and in 2024, we've surpassed 2023 year-to-date. So we are not yet seeing meaningful decreases in our roadway incidents. While we are seeing that at a national level, we are not seeing that in Nevada. I will also say that Nevada is in NHTSA Region 8. There are 7 states in NHTSA Region 8. 6 of them had decreases in 2023, and we were not one of them. This slide is intended to answer the question, how do population increases contribute to our fatal crashes? So we take our fatal crash numbers and we turn that into a fatal crash rate by 100,000 people to account for population increase. And you can see that the crash rate is still trending up when adjusted for population. This slide tracks fatalities by vehicle miles traveled, which creates a rate that helps answer the question of how much does tourism or increased road use contribute to our crashes. Overall, and by all measures, we can see that we are in a sustained period of increases in fatal crashes on our roads. Now we're going to get into some specific demographic information. Again, I'm not going to spend a lot of time on the slides, but I welcome any follow-up or any questions. As previously mentioned, we also look at how traffic crashes are impacting a variety of communities and demographics in Nevada. There are a number of data analyses that I'm not touching on today, such as rural versus urban environments, different types of road classes, and exploring all types of crash-causing factors. In this part of the presentation, I am focusing on specific crash victim demographics. Fatality data from 2018 to 2022 was obtained from NHTSA's Fatality Analysis Reporting System, and Nevada population data was obtained from the 2020 U.S. Census American Community Survey. And this data forms the basis for calculating and comparing fatality rates of Nevada total population to fatality rates for various racial and ethnic groups' population in this state. And the following slides go into a little further detail. These analyses compare traffic fatality rates per 100,000 population across racial and ethnic groups, using the overall statewide fatality rate for 100,000 population as a baseline. The percentage difference between each race ethnic group's fatality rate and the total population's fatality rate indicates if the rate for that group is higher or lower than the baseline. Fatalities involving victims from groups with smaller populations do have a disproportionate impact on fatality rates. This slide shows total fatality rates by demographic, as well as rates for lane departures, speed-related crashes, and impaired driving-related crashes. And our data is trending very similar to what the national data looks like that was presented earlier. The analysis was applied to critical emphasis areas identified in the state strategic highway safety plan and incorporates road user types, behavioral factors, and locations. In some instances, such as work zone crashes on the next slide, the race ethnicity analysis may not tell an effective story, but as work zone crashes are a safety emphasis area, we included them. This slide provides information for pedestrian, bicyclist, young drivers, and intersection fatal crashes. And I do want to mention that there is an error on the young driver chart. The data for Black youth was inadvertently omitted, and in fact, the data shows that they represent 170% more involved in young driver crashes over the baseline. Presenting information in this way helps inform interventions to impacted communities, such as education, additional services, and outreach, and community-based roadway safety projects. Where we might recognize the potential for disparate treatment, we also need to acknowledge that we are seeing disparate outcomes in our various communities. For example, analyzing crash data in this way helps me see that safety programs for child passenger safety should include increased support for low-income, Black, Native American, and Hispanic populations. On this slide, we do a different type of analysis where we focus on income equity and traffic fatalities based on the location of crashes within the U.S. Census tract block groups in Nevada. GIS techniques were employed to identify crashes occurring in U.S. Census block groups with differing median household incomes, less than 50% and 50%, less than 50,000 and 50,000 or more. Income data is available for the U.S. Census block groups where a traffic fatality occurred, not the individual, meaning this data represents the income information of the census block group where the crash occurred and not the income of the crash victim. And of course, people drive in more locations than their own neighborhoods. But this helps us understand that infrastructure and the way a neighborhood and its roads are designed and built, and the way that road users use these roads have critical impacts on safety. Of course, neighborhoods change, and road use can change with it. For example, myself and my two colleagues are currently engaging with a local neighborhood that has significant safety concerns with speeding and a lack of pedestrian facilities. And there's a heavily trafficked multi-lane road which bisects housing on one side and a local grocery store on the other side. So land use planning, both for streets design and zoning and development, play a significant role in neighborhood safety. Nowhere is this more evident than with pedestrians and bicyclists, something that will be discussed in more detail in the next section of the presentation. In the next sections of today's presentation, there will be more discussion of specific interventions or countermeasures that can be considered. You heard NHTSA discuss the Safe System approach, and there's very good detail to be found within the US DOT National Roadway Safety Strategy and on their website. Primarily, I just want to drop a pin that interventions that can intersect with the work you do as policymakers can be a focus area. Good policy sets the standard for safe and sane shared roadway use and helps us form a strong safety culture as Nevadans. By and large, traffic crashes are not random. They are an interaction of roads and human behavior. And as the saying goes, if you can predict it, you can prevent it. And we can predict traffic crashes. And now I'd like to turn over the presentation to NDOT Chief Traffic Safety Engineer, Lacey Tisler, for further discussion on issues impacting vulnerable road users.
Thank you, Amy. And thank you, Chairs Harris and Donate for having us here. My name is Lacey Tisler. I serve as the Chief Traffic Safety Engineer for the Nevada Department of Transportation, and I manage the Highway Safety Improvement Program. It is a core federal aid program funded by the FHWA that receives guidance from all transportation bills, most recently the Bipartisan Infrastructure Law. As part of the Bipartisan Infrastructure Law, the FHWA require all states to develop a vulnerable road user safety assessment program as part of their Highway Safety Improvement Program. A vulnerable road user is someone who faces an elevated risk of harm or injury in traffic scenarios due to the absence of protective features not typically found in motor vehicles. VRUs encompass pedestrians, cyclists, and individuals using wheelchairs, among others. This assessment is designed to tackle and mitigate the rising number of traffic fatalities among the vulnerable road users. The assessment was developed by the DOT team, reviewed by multi-agency partners, such as our Office of Traffic Safety and Public Health, approved by Governor Lombardo and published in November of 2023. The Nevada Department of Transportation's Vulnerable Road User Safety Assessment can be found on the Zero Fatalities Nevada website. The link is at the bottom of this slide. May I get the next slide, please? The Nevada DOT team reviewed the best available data sources for the assessment. They began with 5 years of vulnerable road user crash data, which included information on the crash location, as well as details for injury, age, user type, and primary resident zip code for those involved. The data was cross-referenced with census data, available bus stop data, roadway type, and more. The analysis did not include a detailed race and ethnicity information, as Amy just showed, because that data is not available for serious injury and non-injury crashes. The equity analysis did use census data and concentrated on areas with annual incomes around or below $35,000 a year. Next slide, please. The analysis reviewed all 17 counties and included all vulnerable road user crashes, regardless of the severity. As expected, there was a high number of vulnerable road user crashes in urban areas. This slide highlights the top 10 counties reviewed in the assessment. The remaining counties accounted for another 15 vulnerable road user crashes. It is important to note these crashes are not limited to urban areas in Clark and Washoe counties. Vulnerable road user crashes can and do occur in any community, whether urban or rural, wherever people move outside the protection of a motor vehicle. Next slide, please. So, cross-referencing the data, the team uncovered the following. There is a high correlation between vulnerable road user crashes and high poverty neighborhoods. Vulnerable road users who live in high poverty neighborhoods often use public transportation. The age group most frequently involved in vulnerable road user crashes is 25 to 54 years old, which does coincide with the largest segment of drivers in the United States. These crashes occur most often in Clark County and followed by Washoe, but they are not limited to these urban areas. Where we had the data available, Clark and Washoe County, we were able to find that vulnerable road user crashes occur within 250 feet of bus stops. Vulnerable road user crashes occur on all types of roadways, but they are most common on our local roads and tend to be more severe on arterials where there are higher speeds and a mix of users. And the crash locations and zip code data referenced with the census data showed a very surprising trend. Our vulnerable road users are not necessarily involved in crashes in their own neighborhoods. Rather, these crashes occur when they are traveling in the community to use amenities. With this information, the DOT is collaborating with traffic safety partners like the Department of Public Safety, Office of Traffic Safety, and the Department of Health and Human Services to implement a safe systems approach to interventions, looking at all of our opportunities to provide interventions for these vulnerable road users. And with that, I would like to hand it over to Julia Peak to continue the conversation.
Julia Peak for the record, and I serve as the Deputy Administrator for the Division of Public and Behavioral Health, as well as the representative for the Department of Health and Human Services on the Nevada Traffic Safety Advisory Committee, or NVACS. NVACS was created during the 2021 legislative session, and I was thankful to be nominated to serve on the committee at that time to present. We are appreciative that DHHS was actually named during that legislation as a representative on that committee, as other maybe non-traditional partners like Department of Education. It really has allowed our department to have a voice at the table for traffic safety and motor vehicle safety, and has allowed us to frame it in a public health focus. To highlight this, CDC has noted that motor vehicle safety is considered one of the top 10 public health achievements of the 20th century. In the public health context, morbidity and mortality as a result of motor vehicle crashes are largely preventable, as Amy had mentioned earlier in the presentation. Past successes have been seen in safer vehicles, safer roadways, and safer road use. Examples include protective policies related to seatbelts and child safety seats. However, I also want to note in a recent report from CDC from May of this year, they noted that traffic-related pedestrian deaths in the U.S. are at a 40-year high. I'll also highlight from that report that they noted the rate of pedestrian injury was anywhere from 1.53 to 2.47 times higher for racial and ethnic minorities than non-Hispanic white persons. On NVACS, next slide, Amy, thank you so much. On NVACS, as I conceptualized our discussion in these meetings, the best way I can frame it in my brain is I use the socio-ecologic model. It just helps me to frame where interventions are possible and also understand the intersection and holistic approach to addressing those. Not a new tool in public health, but it really helps frame the interventions for change and illustrates the interconnectedness at all those levels. So quickly, just public policy at the highest level is why we're in front of you today and why NVACS has a role in providing guidance. So this has to do with laws and regulation in government to help reduce or prevent an outcome. In this case, our goal is to prevent injury and death on our road systems. The next level that you'll see in red is related to community. This is really grassroots and has shown through cultural shifts and cultural expectations of road safety. Changes in public policy often eventually result in a social norming change. This can also be infrastructure changes to address any specific community design, transportation access, and services. The next level is organizational, and this is developed within an organization through policies and procedures. In this case, an organizational intervention could be looking at what we do with work travel. So safer vehicles. For us as state employees, we take defensive driving courses prior to using our state vehicles. I'll also note that according to a report from CDC's National Institute for Occupational Safety and Health, they noted that crashes are the leading cause of work-related deaths, so still an area of much focus. Interpersonal, this is the personal social influence relationship that may impact the way in which you or your family or friends approach road safety. For example, if someone in your life has passed away in a motor vehicle crash, the way in which you and those loved ones travel the roads changes. Personal experience in that regard. Also individual. So though the smallest in the diagram I've shown you, hugely important. So the individual includes personal characteristics, knowledge, attitude, and skills related to road safety. This also has a demographic influence, as we've shown on the prior slide, so age, et cetera. Next slide, Amy, thank you. One of the tasks of NVACS is to provide guidance on policy priorities in hopes of making a change at that largest level to benefit the most people in our state. So on the next slide, I want to highlight our current traffic safety policy priorities. Road safety cameras in school zones, road safety cameras generally, primary seatbelt laws, higher fines in school zones, graduated driver's license, safe systems intersections, traffic records, yield for pedestrians to stop for pedestrians, appropriate speed limits for all road users, and fostering DUI intervention programs. I'll just note that there are asterisks indicated where legislation would be required, but for those items that don't have an asterisk, this group and the agencies working on these topics are actively working to make changes in those areas. Though all of these are needed to reduce the risks on the road, those that I've bolded on this slide are the two that the committee wants to highlight for this biennium. and are related to road safety cameras generally and fostering intervention programs for those driving under the influence. On the next slide, I've provided a couple links to those specific interventions. The NVACS committee with subject matter experts have put together some really good background on that. I'll highlight this quickly, but I encourage everybody to visit those hyperlinks. Road safety cameras, the primary benefit is to really get at speeding and aggressive driving, which are a major cause of injury and death on our roads. The DUI intervention programs is another focus that DHHS is specifically interested in as well. So while existing laws and penalties aim to deter and punish DUI offenses, there is a growing need for a more comprehensive approach that addresses the underlying issues contributing to this behavior. Despite widespread public awareness campaigns and stricter enforcement efforts, the number of DUI-related incidents remain alarmingly high. Traditional approaches such as fines and license suspension have proven effective but still inefficient to addressing the root cause of the health issue. For those reasons, the committee proposes intervention tools to help prevent DUI recidivism and assist in aiding those offenders who may suffer from DUI-related issues. Tools could include screening and assessments that identify the highest risk and highest need individuals in our community for interventions, requirement for pre-trial services to supervise DUI arrests pending adjudication, and amending the sober 24 drivers license restrictions to provide a 24/7 sobriety privileged driver's license. I also want to highlight just some data because our youth risk behavior survey just recently came out, and I wanted to share that. For our middle school students, there was an increase in both the number of students who reported that they have ridden with somebody who's been drinking alcohol and ridden with somebody who's been using marijuana. For alcohol, it went from 18.5% to 21.9%, and then for marijuana from 13.8% to 16.7%. For our high schoolers, they reported less, but only slightly. With that, we are happy to take questions that the committee may have.
Okay, thank you. Committee members, do we have questions? Okay, Assemblywoman Brown-May.
Thank you. Thank you, Ms. Davey, Ms. Peak. Thank you so much for being here. First, I have to say I was recently appointed to serve on NVACS as the legislative member, and I'm very honored to be able to be there and have just completed my orientation. So really excited to be joining you in those efforts. I do have one question relative to one of the slides that you just discussed, just for clarity. Ms. Davey, you had it as part of your presentation. It's the orange or yellow bar graph where it shows us the high percentage of pedestrian fatality, and it's that one. Thank you. And you stated when you were talking about that, I believe I heard you say that this is about where crashes are happening and the economics of the intersection as opposed to the person in the crash, right? 50,000 or less low-income communities. So we're seeing more crashes where there's less infrastructure, as I believe what I heard you say. Will you just clarify that?
Sure. This is Amy Davey from the Office of Traffic Safety, for the record. And I'm looking at the methodology that was applied to create this document. So I'm going to read from that methodology just so I'm clear on explaining this. The analysis focused on exploring income equity and traffic fatalities based on the location of a crash within U.S. Census tract block groups. GIS techniques were employed to identify crashes occurring in areas with differing median household incomes, those of less than 50,000 and 50,000 or more. So this is the location of the actual incident or the crash, not the location of the individuals involved in that crash. So I think that when we talk about the roles of infrastructure and the way a community is built or a neighborhood is built, there's two elements there. People travel outside of their communities, but also people from other communities travel through areas that can have insufficient infrastructure. And so there's both components there, but by and large, I think what we can say across the board, I don't think there's any disagreement that when you have insufficient infrastructure, or infrastructure that encourages maybe discourages certain types of roadway use or encourages other types of roadway use behavior, you're going to see more risk.
Chair Danyate.
Thank you, Chair. I have several questions. I'm going to start with Ms. Davies. So with the slide that refers to the rising, so I think this is probably the magic question that you probably get asked a lot. There's your first slides that show the increase of fatalities per 100,000 population. What are some of the risk factors that you see in terms of why that is increasing over the years? I would assume that most folks probably make the assessment that it's probably because our population is growing, but there probably are other factors that we're seeing on top of behavior that are leading to that. So in your experience, what is driving that increase, and what are some things that us as legislators can focus on to at least plateau it and try to bring it down?
Thank you for the question, Amy Davey, Office of Traffic Safety. So yes, the reason that we turn crash numbers into rates is to kind of answer the question about road, how much our roads are traveled or how many people are moving here. Our top risk-causing factors right now in Nevada, first of all, our vulnerable road user crashes are really high. And so vulnerable road users are subject in large part to what's going on in the environment. They don't have the protection of a vehicle around them, and they're really subject to what other road users, how they're using the road. So you heard our partners from the National Highway Traffic Safety Administration talk about the impacts of speed on vulnerable road users. Pedestrians, motorcyclists, bicyclists, anyone using micromobility devices. So our vulnerable road user crashes are very high in Nevada. Additionally, our impaired driving crash rate is very high in Nevada, which I think is a little bit baked into our culture, and it's something that we probably need to think about turning around. If I ask any of my colleagues across the country, what comes to mind when you think of Nevada, they say Las Vegas. What comes to mind when you think of Las Vegas? What happens in Vegas stays in Vegas. So we have a little bit of a culture around, come and have fun. And I think that we need to maybe approach that a little bit differently when we think about the people that live here and the people that, I'm not against fun, don't get me wrong, but also having fun in a way that's responsible and doesn't impact our community. So in terms of impaired driving, our fatal crashes, through my office, we track that information. 55 to 60% of our fatal crashes include somebody in that crash who was substance involved. I don't use the word impaired because I don't make that determination as to whether or not they were impaired, but there were substances in their system. They were substance involved. That's very high, 55 to 60%. So impaired driving, vulnerable road users who are subject to every driver's behavior, and then speeding. We also have a culture of speed in Nevada. We have big, long distances to travel. Those of you in Las Vegas, you have big, wide, fast roads through your neighborhoods. And so when we treat speed and speeding, I kind of joke with a colleague, speeding is like the only law we all feel comfortable breaking. Like we'll show up to a party and say, oh, I had to, speed to get here, versus, I shoplifted this wine for the party today. So I would say we also have a little bit of a culture around speeding, and I think we need to probably reverse that and look at that also. So I hope that touches on sort of like what are we seeing? It's not just population increase. It's not just tourism. It's not just people traveling through our state to get somewhere else. There really are certain behaviors that are contributing.
Thank you. It's interesting because as you're reiterating your comments, I think back to some of my public health classes, and they taught us the 3 E's. It's education, enforcement, and engineering. I firmly believe that most of our efforts to improve traffic safety need to be focused on engineering, just because by human nature, we can't really control behavior as much, but we can do a lot in terms of infrastructure. So do you think other states that have mass transit systems have lower fatality rates? Do you think the absence of having a robust mass transit system either in Southern Nevada or Northern Nevada or looped together is what enables us to have such high traffic incidents? Your example of folks coming in from out of state, I mean, I think if we had a system where when you land at Harry Reid Airport, you can go directly to the hotels without having to take a cab and so forth, as we see in other cities, right? If we had that ability, then maybe we wouldn't be in that position, but I would love your feedback on that.
Amy Davey, Office of Traffic Safety. I would actually love to study that. I've never thought of it in that way. I think we sort of inherently know that public transportation tends to be a more safe option than everybody in their cars, doing their own thing. I would love to study that in a more comprehensive way. I think we can look and point to some large metropolitan areas that do have strong public transit systems. One of them that comes to mind is Washington, D.C., has done a really good job of lowering, in that city, of lowering their fatalities. And I have to believe that public transit options do contribute to that. One of the things you probably noticed in the vulnerable road user assessment was NDOT identified that there's a high preponderance of vulnerable road user crashes that occur within 250 feet of a public bus stop. So again, that's something we need to be thinking about. I don't want to pick on, I work with everybody in all government agencies, and so I don't want to sound like I'm picking on anybody because public transportation is not my area of expertise, but I notice in Las Vegas, your bus stops are mid-block, and so when you let people off in the middle of the block and then ask them in 110-degree weather to go a long distance to find a crosswalk, you're sort of going against human behavior. So I also notice that people get off the bus and cross mid-block in traffic. And so that's one of those intersections I think of, in transportation policy where you have to think about convenience and capacity and also safety. And I'm not an expert on public transportation.
Okay, we'll go to Assemblyman Carter.
Thank you. My question has to do with, and I know that we've seen a move towards decriminalization, moving to civil penalties instead of criminal penalties for traffic enforcement. And we do see quite a preponderance of high visibility enforcement efforts, especially in the DUI world, and notifications that there's going to be speed enforcement in different areas. Has it been studied about moving towards high visibility patrols that create public safety and traffic calming? What I'm talking about is enforcement officers being in high visibility vehicles and high visibility clothing. That way, rather than the current system that is perceived by our constituents as hide and seek to generate revenue, we see that parent that's stressed out and maybe speeding, trying to get their kid to work, get their kid to school, will slow down if they see an officer, where that impaired or just plain jerk will speed right on past. And has that been explored at all?
Amy Davey, Office of Traffic Safety. The short answer to your question, I think, is yes. Enforcement has been studied as a measure to produce traffic calming and to change behavior. And yes, enforcement does work. Specific to the what law enforcement, the visibility of a law enforcement officer, or what they're wearing, or if they can be seen, yes, we know that if you can see a law enforcement officer or a car, I don't know about you guys, but I don't speed up when I see a law enforcement officer. So yes, there is a traffic calming impact to having law enforcement on the roadways. Beyond that, I can't really speak to how they patrol or what, how they're marked or not marked. My office funds a lot of high visibility enforcement because it is a proven countermeasure. It's a proven intervention. And so we do fund a lot of what we call high visibility enforcement. A little bit different, I think, than what you're referring to, Assemblyman Carter. When we talk about high visibility enforcement, we're saying we want to see a lot of, law enforcement out there where they can be noticed by the public. So they do provide that traffic calming. And they always, we have one of the requirements in our grants is that you always put out a press release to the public. We're going to be doing, speed mitigation. Law enforcement will be out looking for DUI. You'll see those, those spots come out in the newspaper and so forth. So I hope I answered your question.
You did, and thank you.
Okay, we'll go next to Assemblyman Ornlicker.
Thank you, Chair. Thank you for the presentations. I want to go back to the last two slides, please. You identified 10 traffic safety policy priorities, so thank you, because that's very helpful to us. And then there are the 2 road safety cameras and the DUI intervention programs that you bolded. So one reason you might have bolded those 2 is because you thought those would have the biggest impact in reducing fatalities. So that's the first part of my question. Is that why you picked those 2? And then the other, for the 10 overall, I'm wondering what kind of metrics you can provide in terms of, for each of the 10, what your estimated impact on reducing fatalities for each of the 10, and then maybe you could adjust that for cost. So road safety cameras is going to cost more than higher fines in school zones. So you could tell us how much it'll cost us to reduce the fatalities. Do you have those kind of numbers?
Well, how much time do we have? I'll give you sort of the high level of how we got to this list, and then talk a little bit about how we can maybe go deeper into the list at your interest. So this list was put forward by the Nevada Advisory Committee on Traffic Safety. I sit on that committee. Julia Peek does, as well as Lacey Tisler, and a lot of other people. There's 20-something organizations represented, your metropolitan planning organizations, your law enforcement, your courts, your legislators, your state departments, Department of Education. They all sit on this committee. So what we did, Assemblyman Ornlicker, is look at national best practices, proven interventions, and then we looked at our data and we cross-referenced those. So where we said Nevada has a speeding problem, then we looked at, for instance, the National Roadway Safety Strategy has an entire list of recommendations to address speeding issues. And so that's where you see the road safety camera discussion. So these were all policies that were put forth by, there's also a very large body of working groups and task forces of subject matter experts in Nevada, and they brought forward many of these ideas for discussion. It was a very robust process with the executive committee over several months of discussion and looking at data and looking at national best practices and prevention strategies to come up with this list. The 2 that are bolded, Senator Harris sits on the advisory committee as well. She encouraged the committee to put forward a couple of proposals for BDRs. And so the committee again reviewed all of this, the list in its entirety, and selected those two countermeasures to put forward as proposals. So that's why those 2 are bolded. And then Julia has done a really good job of indicating for you with the asterisks other proposals that would require legislative action of some type. So if there's something that you're specifically interested in, I'd be happy to research. There's a lot of research behind them already, but I'm sorry I didn't bring it with me today on every one of these proposals.
Okay, thank you. But getting back, best practices, presumably they do look at what will have the biggest impact. Can we conclude that road safety cameras will have the biggest impact on reducing fatalities or not necessarily?
I think we can conclude that there's a comprehensive approach needed.
Don't forget to restate your name as you speak.
Julia Peak, Department of Health and Human Services. Sorry, I'm being a microphone hog. Amy Davey, Office of Traffic Safety. Oh God, now I can't remember the question.
I believe he was.
Oh, thank you. Yeah. There's a multitude of approaches. The National Roadway Safety Strategy. It's a complex number of strategies involved. So this was one that the committee did feel like would address. For instance, high-risk intersections where you're seeing red light runners, road rage and aggressive driving where you're seeing people drive very dangerously as a choice, and then excessive speeding. Those were all discussed when we looked at road safety cameras. And the data behind a road safety camera system from a safety standpoint is rock solid. Rock solid. They absolutely, because for the same reason that a law enforcement officer is going to lower speeds, having a sign up that says, speed cameras in use, lower speeds, or intersection cameras, in use, don't run the red light, changes behavior. So I can't, I can't promise the outcome, but these are all pretty tested and studied, which is where we derived our list from.
Thank you.
Okay. Senator Daley has a question.
Thank you, Madam Chair. And if people remember when we had the new term you guys have from today called road safety cameras, same questions, got the issues. I won't ask them specifically. I got the answers before, and I think I know where everyone's at. But from cameras being used to enforce traffic laws to road safety, who can be against road safety, why are we not calling it what it is, which is just enforcement? And then you have all of the issues surrounding, the revenue around it. Yes, we want to try to change behavior, but it also, I think, just creates several other privacy problems. Who are you going to issue that citation to? You're going to issue it to a car rather than a person. How are you going to get around all of that stuff?
Amy Davey, Office of Traffic Safety. I anticipate that we'll have a pretty robust conversation. If a bill is brought forward on this, that will address a lot of those concerns. Automated traffic enforcement those programs have changed significantly in over time, and even in the most recent last couple of years, those programs have changed significantly, and you find them more and more adopted, particularly like in school zones and work zones where you've got people that are very vulnerable. So I think that all of those, for sure, all those conversations around people's concerns will be vetted out.
And I understand, and I know I've talked with some people that want to put them in work zones or, et cetera. And I worked on the road, know a lot of people that do. And yeah, they are vulnerable there. So everyone wants to incrementally baby step also as well. If it's good enough for school zones and it's good enough for work zones, and how come my neighborhood's not special too? it's just the incremental progress towards having it everywhere, and I just have my issues with it, I guess. So the fancy new word doesn't help.
All right, Senator Titus.
Thank you, Madam Chair, for the opportunity, and thank you both for being there. And I will requote that analogy. I'm married to a retired sheriff, and breaking the law and speeding that everybody seems okay, but not stealing to go to a party, a bottle of wine was wonderful. So my question revolves around the legalization of marijuana in states, and you gave us a lot of information on accidents, impaired drivers, and I was just wondering what the data looks like for impaired drivers with marijuana in their system, and what those numbers look like now in the states that have legalized marijuana. Do you have that data set, if that's increased?
I do. I have a really good chart, and I'm going to send it to you. I didn't bring it today, but just to Amy Davey, Office of Traffic Safety, of course. Just to kind of give you an abbreviated answer, what we've seen since we've been tracking, which was the few years prior to legalization of recreational cannabis to now, is that marijuana. What we're seeing in terms of DUI is polysubstance use is really the highest now component. Where we always talk about, drinking and driving, it's really polysubstance use now, where we're seeing a very high increase, mixing different substances. And of that group of polysubstance use, marijuana is the highest, most rapidly increasing subset of people that are mixing.
So along that same lines, in Nevada, years ago, we have adjusted legal driving limits, and we had to do something regardless of, everybody's impaired perhaps at a different blood alcohol level, but the state set on 0.08 as whether you can demonstrate impairment or not, or we can prove impairment, can't drive past 0.08. Other states, we've struggled with what do we do with the marijuana levels? How do we document that? Have other states come to any better solutions on impairment with marijuana in your system? Are you aware of any of that information going on?
Amy Davey, Office of Traffic Safety. In terms of setting standards and levels, no. There isn't yet. That science has not caught up with that particular. So 0.08, alcohol dissipation. I mean, you're a medical doctor. You could teach me this, but alcohol dissipation has been, absolutely studied. There's a lot of research behind it, and dissipation of marijuana in your system has not yet been identified or pinpointed, which I know were the conversations around, trying to understand how to set a level. Nevada has what's called an impairment standard, so you need to prove impairment, that somebody was impaired versus, at least with respect to marijuana, a specific level.
Great, and I appreciate that. It's something that we struggled. I've been a medical review officer, so I do the drug screens. I review all those for employers, et cetera, and it has been something difficult to track. So just want to know if you had seen any later stuff, but I would appreciate seeing that data and that chart that you have, and thank you for what you're doing. Thank you, Madam Chair.
Okay, Senator Nguyen.
Kind of in line with what Dr. Titus had just asked you about, I know that with the ongoing opioid crisis, do you see, have there been significant increases in the amount of, prescription or otherwise lawful medication, whether it's like sleeping pills or Xanax or those with respect to DUIs?
Thank you for the question, Amy Davey, Office of Traffic Safety. I'd like to go back and run the data that we do have and see if we can get it down to that those specific drug categories or drug types. The data that we do have is on fatal crash victims, so it comes from coroner's reports. With respect to DUI, we don't yet have consistent laboratory test process across the state. Nevada is the only state, you've heard me say this before, I'm going to say it again, Nevada is the only state without a state toxicology lab, state-level toxicology lab. We use local toxicology labs. Law enforcement uses Las Vegas Metro PD or Henderson PD or Washoe County SO. And so they maintain their testing practices according to their own processes. They are working together as colleagues to create standardized processes, but it also means we don't have access to good data because you can't go to a single, every other state in the country, you can go to their DUI forensic toxicologist and say, give me the information on DUI testing and what are your standards and what are your processes. So we got some catching up to do as far as toxicology goes.
So you have that information when it comes to like things like marijuana and alcohol, but you don't have that information when it comes to other statuses of impairment.
Yeah, for Amy Davey, Office of Traffic Safety, I do have that information for fatal crash victims, not for DUI, for fatal crash victims. I'll need to see if I can pull it down to that level. The federal government, so our office reports all of the data to NHTSA, and NHTSA has only required, I think, those categories of drugs in the recent years. So I can get some recent year data, but I'll need to go back and pull specific types of drug categories for fatal crash victims. So that's not the same thing as DUI.
And then when it comes to that, are there any state, I think I know the answer to this as well, but I know that we don't have levels when it comes to like prescription drug use. And just with all candor, I know that a lot of the DUIs that I saw when I was practicing in that area were increasingly polyuse and predominantly a lot of like prescription medications. So there was this understanding like, oh, I've been prescribed this medication and therefore I can drive with this medication even though it had impairment. Are there any states that have looked at developing levels or other metrics other than just general impairment when it comes to prescription drug abuse and driving under the influence of those?
Yeah, Julia Peak for the record, Department of Health and Human Services. I'm not, but we'll go back and look.
And then if I may have another question, Chair. Okay, I'm getting a wave here. I was also looking at those recommendations for the cameras. Is there any reason, like, it's my understanding that those are authorized in law to have traffic cameras. You just have to have them maintained by actual law enforcement officers that are watching and monitoring those cameras. Is there something in these recommendations that you're hoping to accomplish by way of legislation that already doesn't exist in law?
Right, Amy Davey, Office of Traffic Safety. So currently, Nevada law says that a device used to record a traffic infraction, photographic or digital device, has to be held in the hand of a law enforcement officer or mounted to a law enforcement building. So there has to be law enforcement presence. So it's not a system that has been integrated into any other kind of situation where an actual person is not there. So right now we're prohibiting any type of automated traffic enforcement system that doesn't require a law enforcement officer to be holding a radar gun or have a camera mounted on a building.
I'm sorry, but just those, like, there are like in Southern Nevada, I know that there's Metro cameras that are on the, I guess is that considered when you see those cameras that are located in high like crime areas or in certain areas where they're mounted onto, I guess, one of the Metro vehicles, is that considered acceptable?
Amy Davey, Office of Traffic Safety. For a vehicle, it would be within
Well, it's not on the vehicle. They're just sitting in parking lots. Like they're on a big post.
Oh, okay. Amy Davey, Office of Traffic Safety. I'm not aware of what types of camera systems might be in use by law enforcement. I know there are camera systems in use by, for instance, the road camera systems, but those are not used for any type of enforcement action. So there is a whole camera system in Las Vegas that looks at roads for the purpose of there's an issue, there's a slowdown, there's a light out, but they're not used for any type of enforcement action. So it could be that is what you're seeing. So it's just a little bit different when we talk about using a camera for an enforcement action.
I may have legal look into that because I distinctly understood that law enforcement could enact these traffic cameras or red light cameras. They just had to have someone monitoring it. Obviously, I have concerns with the overuse that a lot of these traffic cameras have with AI. I obviously don't want to see the automation of policing. So I have concerns with some of those cameras for that, in that respect. But thank you. I appreciate that, and I'll do some more research.
Okay, we'll go back to Chair Dunyate. He has a couple more questions, and then I'll have a couple, and I promise we'll let you go after that.
Thank you. So talking about driving under the influence, this question is more probably for Ms. Peak. I want to talk about the education that occurs once that infraction happens. I know that a lot of it, several different states have started looking at including harm reduction as part of the education structures of actually teaching folks these are the mistakes that occurred, but this is what led to this mistake, so let's make sure that this doesn't repeat again. What reforms do you believe are necessary in terms of the education that comes when these infractions occur? Or are there tips or guidance that you can give us to the legislature to start looking at certain examples?
Yeah, Julia Peak, DHHS, I'll start and then defer to my colleague, Amy Davey, as well. So a lot of what we do in public health is prevention and intervention, ideally as soon in the process in primary or secondary as possible. So some of the recommendations we've talked about at NVX is trying to figure out how to intervene at the point of citation, ideally prior to that. And that's what public health is focusing on, the primary prevention of the use of the drugs. And then this is more secondary prevention, where we would come in at the point of citation and figure out high-risk individuals, high-need individuals, and what education and intervention can be provided for those individuals prior to their hearing in judicial. You guys approved specialty courts in the past, and I think that's been a huge opportunity to help folks get treatment. But there's opportunity way prior to that to intervene. Amy, did you have more to add on that?
Well, I do have some good news for you. This is Amy Davey, Office of Traffic Safety. Thank you, Chair Dunyate. One of the things that we recently were involved in was a working group around, so right now, there's a couple of elements in law that you can consider. One is we have language in there that says if you're 0.18, so we've identified a certain alcohol level. If you're 0.18, you're going to be you're going to have an assessment or some type of screening. You were really drunk, and so you should have an assessment. But under that, it is optional. And so one of the things that we talked about at NVX is should we provide screening and assessments? And these are standardized, these are standardized tools. And then identify high-risk, high-needs individuals. A lot of times what we see in DUI is the first time a person is caught driving under the influence is not the first time they've driven under the influence, many, many, many times. And sometimes you see people with many, many DUIs. So clearly we need a better system that identifies folks that need more interventions, and that'll provide better public safety for us and for them. But one of the things I was going to say that we're able to just do, working with the DMV and with a group of mental health professionals, and I know they came and the coalition came and talked to you folks, was change the standards around that course that you're required to take when you get a DUI. You're required to take a driving, kind of course to get your license back. And we were successful in just changing those standards from any curriculum that anybody thinks is a good idea to behavioral-based intervention curriculum standards. So if I get a DUI, and I'm required to go take that course to keep my license. We took it from, I think, 8 hours to 12 hours, and you're now required to do an interactive course. It can't just be online. It can be virtual, but it has to be interactive, and it has to include proven behavioral intervention, substance use strategies. So that was one thing that we recently were able to do, sans legislation, through the regulation process.
Great, and thank you so much for that. In terms of, I know there was a highlight of screening and assessments. Are there opportunities that we can start to look at? So I know we've talked about, for example, fetal alcohol syndrome. We've talked about screenings in emergency rooms and so forth for various prescriptions and so forth. So what opportunities do you think that we can do to work with the healthcare sector to at least start to address these issues before it becomes a citation? So I guess, are there things that we can do to improve screening and assessments to do more primary prevention?
Yeah, Julia Peak, for the record, probably another statement is how much time do you have on that one as well. There's lots of opportunities to incorporate behavioral health and mental health service screenings into primary care or other settings. I can provide some examples of what our team has been doing at the Bureau for Outreach. We also have our community-based coalitions that are really the boots on the ground for the community to do that outreach and interventions. They work closely with our partners in traffic safety to figure out what interventions are there, but I also think immediate referral for resources beyond the screening. It's great to screen an individual, but you need to be able to offer real-time resources for that individual to seek care for the services identified. So that is a work in progress and has to do with access to those specialty services, and the teams working on that can provide more information as you're interested.
Great, thank you. And then just last question, state toxicology lab, how much money do you need for that one?
Amy Davey, for the record. We actually, NHTSA actually paid for an assessment of Nevada's lack of toxicology lab. This was probably about 5 years ago. So I have a full assessment report, including a budget, that I can forward to you. Yeah.
Okay. We actually have one more question from Senator Nguyen, and then we'll close it out.
Okay, really quick. You had talked about how just having the signage and some of those things have been like a very big deterrent. Has there been any kind of movement with your agency to just put up signs or to have, I know I've recently done quite a bit of traveling throughout the state of Nevada, and I know it seems like one of the biggest things to slow down speed is having those like traffic devices that are put up that tell you how fast you're going and tell you to slow down. Have there been any movements? I know that they are along our Nevada roadways, but have we looked into putting more of those up?
This is Amy Davey with the Office of Traffic Safety. I have a lot of great ideas like you do on that, but I'm going to defer to NDOT.
Thank you, Amy. Lacey Tisler, Nevada Department of Transportation. A speed feedback sign, which you're referring to, is an FHWA proven safety countermeasure, and that's one of 21 recommendations that we often look at when we are recommending interventions along the roadway from the infrastructure side. So, yes, depending on the case, the environment, the ability for maintenance personnel, the prioritization. So, yes.
Julia Peak, for the record, if I could just add personal experience, we had the opportunity, as Amy had mentioned, to go to a town hall in the community. She mentioned one of the main things they noted is please just put signage up that says we live here, and please slow down, our kids cross the street. And so that from our residents is something that changes behavior in all of us. If you recognize something on the road that says our kids are crossing the street, you slow down by default. It's a behavior change mechanism. So I just want to say we heard from the residents that that is something that they're interested in seeing.
Okay. Hopefully this won't take too long, but I don't think this is the shortest part of the discussion. You've got quite a few recommendations here that are that are on the back end, right? This is what happens after we catch you. So road safety cameras, the higher fines. What are the suggestions that you have for the front end? That's often the harder part, right? So what suggestions do you have on how we stop people from engaging in risky driving? How do we stop people from running lights before we have to send them the automatic traffic ticket, right? Because frankly, I don't want to do the back end if we're not also doing the front end. It would be, we're just chasing losses if we continue to try and enforce our way out of it, right? So what recommendations do you all have that fit on that front end?
Hi, Amy Davey, Office of Traffic Safety. I absolutely agree, and thank you for the question. A lot of them, some of them are, may be easier to implement than others, but one of the things that we talk about now with this safe system approach is that humans make mistakes, and the price of a mistake shouldn't be, death or serious injury, and that we need to build a system that accounts for human mistake. And so that includes changing our roadways. There's a lot you can do, and you're going to hear from our partners about things that they have done to change infrastructure. But I know if you drive down Carson Street to get here, you really can't go very fast because that whole street has been redesigned to make you slow down and to make it safer for all types of road users. So those kinds of complete streets programs and those kinds of things that should be addressed through infrastructure will change human behavior. Education and outreach for sure. We're always involved in my agency in education and outreach and social norming, and I'm not an expert in this. I'll completely defer to public health and social health on this, but social norming and just creating a different culture in Nevada about what is acceptable and what we all do in the public space together. Roads are public spaces, and just like I wouldn't walk through a crowded community park swinging a baseball bat around my head and then say, oops, did I hit you? Sorry, I was just exercising my arm. I can't go out on the roadway and just behave any way I want to either. So social norming, outreach and education. I think we need to, I'm going to get killed for this, we need to look at our drivers' education system that was taken. I went to school here. You had some kind of driver's ed when you went to school, and we don't have that anymore. So we don't really have a strong system of educating and providing good information to new drivers, to people that move here from other states that may have come from different places and have different rules of the road, and training young people. So I think that on the front end, helping drivers learn how to drive, to me, there's huge gaps here. I'm sorry, there just are. And if you've moved here from some other state, I hear it over and over again. How does my child learn how to drive? What if you don't have a car in the family? How are you ever going to learn how to drive? Because the only person that's going to teach you in our system is your parent. I'm going to go on a rampage here. Is your parent, right? What if you don't have the money to go take the driver's training class at the community college and it's no longer offered in school? How are you going to learn how to drive? So young people are waiting until they're 18 years old to get their driver's license, because then you can, go online and take your test. So I think there's opportunity there to really look at how we're preparing and training people to share our space on the road. Sorry, shutting up.
No, that's great. No, this is exactly what we need to hear. I'd love to hear from Department of Public Behavioral Health and also NDOT on your thoughts on what, at least, especially what the legislature might be able to do on the front end. I'm looking at your list, and you have some things that maybe aren't asterisks, and I think that's your imagination is being limited. Trust me, we can legislate almost anything. So I'd really love to hear. As long as it's constitutional, yes. Yes, you're welcome. But I'd really love to hear what ideas that you have that the legislature might be able to enact to help with that front end.
Sure, Julia Peak for the record. I agree entirely with social norming. That's the first thing I wrote down in the answers to the question. Speeding is a social norm that's comfortable for people. And so that may require policy change to ultimately change people's comfort level with that. Also, as I gave you the information on YRBS, our middle schoolers, of which I have two this coming year, more likely to get in the car with somebody driving under the influence of alcohol or marijuana. That's a social norm. So if those are our future drivers and they have a level of comfort with that, how do we intervene to tell them that that's not something they need to be comfortable with? So some of it is education and outreach. Our list is policy-based. It's not all we're doing. So I'll say we're doing a lot related to education and outreach, and I specifically want to thank my two colleagues joining me today on this, but we are very data rich in traffic safety. As Amy said, there are gaps, but there's a lot of data we can use. So on the front end, what we're doing. So some of the things that we're trying to do as this triad with many partners is look at the data and figure out what interventions that we could implement through community-based partners. So one example of just some of the things we're looking at is a more solid partnership between NDOT, DPS, and our coalitions for minority health and equity. Our minority health and equity office has been really engaged. They're going to serve with me on the equity working group that Amy suggested for NVX. And so that's going to be diving into the data really much more closely. But also the second piece to legislation is the funding. So Amy and her team are looking at how they can better fund our coalition and better fund our office to focus on traffic safety, injury prevention in this area. So some of the things that we're talking about as part of that effort is walkability studies. That's on the preventative end. However, that is based on data. So accidents have occurred there. So unfortunately, we can't prevent what's occurred, but we can look at those high-risk areas. And then what this team's looking at doing is the walkability studies, the focus group with the folks that live in that community to offer really solid suggestions of what they see would like to change in the community. And again, I've witnessed one town hall that was a quasi-focus group, and what they saw as the issues were maybe different than what we saw as the issues, and so hearing that was vastly important. So that is prevention. That is understanding and talking to the community about what that looks like in those areas of high need. The other thing, again, them being very data rich, is some of the risk behaviors that can be mitigated. Seatbelt use in certain communities, child safety seat use and appropriate use of that is something we really need to look at and does have demographic differences. And so we could say, why does this community not use child safety seats? Can they not purchase them? Do they not have the ability to purchase them? Are there too many people in the car so it can't fit? Like, there could be a number of things. Do they not think they work? And so it's understanding from those communities, why are you not doing this thing that is preventative, and then offering an intervention. So we've had some ideas, but it's really working with NOMI and our coalition to get in those groups and ask really important questions so we can offer some preventative suggestions. And I'll give it to Lacey now. Thank you.
Lacey Tisler, Nevada Department of Transportation. Thank you, Chair Harris, for this question. You pointed out the two items on the list, the appropriate speed limits for all users and safe systems intersections. Those are both based off of crash data, but understanding our crash risk based off of the information that we're receiving that data, we know that higher speeds through neighborhoods result in more fatalities and serious injuries on our roadway system. So prioritizing those areas where we have those higher risk and building those systems in as road users is the heart of this recommendation, even though it's not for policy. Same thing with the safe systems intersections. Building intersections for each and every user rather than just prioritizing the motor vehicle, allowing people to move safely. Intersections are our number one contributing factor when we look at our crash data. We are a focus state by the FHWA because of our intersection crashes. So building those for our most vulnerable will allow us to prevent fatalities and serious injuries for all users. And then one other thing to note, and I didn't get into deep on the vulnerable road user safety assessment, but we did understand that a lot of our fatalities were clustered into certain zip codes and certain zip codes that had lower incomes. So working with our partners at the Office of Traffic Safety and with public health and with the partners that know me that Julie Peak mentioned, how do we understand how these people use the system and not just build a crosswalk, but understand their movement patterns to build a crosswalk and include the systems that work for them so they can move and be part of society.
Okay, thank you. And I think, that's the safe system intersections is a great example of what I was talking about, right? I mean, that is something we could legislate, right? That these types of things be included every time a new intersection is developed, of course, with the appropriate amount of local control. But, some of these things we can start to at least nudge people towards doing at the state level, because I personally really do want to make sure that we're focused on the front end, even though it's often the more difficult side to address because of all of the different factors you all are mentioning, right? Okay, with that, I'm going to let you all go. Thank you so much for being great troopers.
I just want to say thank you for the robust conversation. I feel seen.
Indeed, we aim for that here in this committee. I appreciate it. Okay, we'll go ahead and close out agenda item number 4 and open up agenda item number 5. That's a presentation on NDOT Complete Streets Policy. We have representatives from NDOT here with us today to present, and I will go ahead and turn it over to you to begin whenever you are ready. Don't forget to state your name before you begin. Thank you.
Good morning. Thank you for that. Sorry for the delay. I'm Rebecca Capular with the Department of Transportation, and for the record, I am the Assistant Director over Planning at NDOT. I have a few colleagues with me today that I'd like to introduce. Lacey Tisler, who was just on the last one, she is joining us from Elko today because it is our first Rural Safety Summit, and I wanted to highlight that because I'm excited. I was there yesterday, but I came back today for this. She is the Chief of Safety Engineering. And also with me, my colleagues are Joe Harrington, he is the Director of Communications, and Kevin Berry, the Chief of Multimodal and Program Development. And as we continue, if I have any questions that I can't answer for you, I may ask if it's allowable one of my colleagues to jump in. And I want to make sure my presentation is going through. I see it here, but I don't see it up there. So hold, please.
We can see it.
You can see it.
We can see it. Yes, thank you.
That's even better. Thank you. It is my first time testifying before the board, so if I do anything incorrectly, please correct me because I want to learn from this and do better next time. I am
killing it so far.
Thank you, thank you. I am happy to share the department's current practices and future goals with Complete Streets in this joint meeting as we recognize the intersectionality of transportation and public health in a safe systems approach, which I think this morning's 2 previous presenters have really set the stage. So I'm really excited to continue on. Complete Streets are streets designed and operated to enable safe use and support mobility of all users. The Federal Highway Administration definition of road users includes people of all ages and abilities, regarding of whether they are traveling as a driver, pedestrian, bicyclist, or public transportation rider, which I think we've kind of set that stage for already today. The Complete Streets approach is not just a product or a street, it is an approach to planning, designing, and building streets that enable safe, equitable access for all users. The department, along with countless other road users and owners, are shifting to moving people as it uses Complete Streets approach to do so. Historically, we were always moving cars, and now we're trying to shift that mindset to moving people. This approach often leads to the creation of more livable, sustainable, and equitable communities through an accessible and safe street design. One example of this is the Ely Complete Streets project. And on the slide, you can see a small little picture up there, but it shows a lot of different elements for whether you're driving, walking, or biking. US 50 serves as a main street through the community of Ely, which is home to almost 4,000 Nevadans and experiences a significant amount of tourist traffic. This Complete Street project includes strategies and elements that allow accommodations for all road users. It uses design elements of self-enforcing roads, which we heard earlier today, which often slows down traffic. Years of study and data collection are coming together in an exciting project that will allow locals and visitors alike to move safely in and out of motor vehicles throughout the Ely community. The completed rebuild of the community comes with a significant planning and expense, however. The department sought discretionary federal funding, including a $24 million raise grant, in addition, $5 million in earmarks to support the $45 million project to transform Ely's main street from a historic state highway to a Complete Streets project. US 50 has been designated as a US bike route, and this project is expected to support both the economic vitality of Ely's downtown, along with safe and equitable movements of locals and tourists alike. According to the National Complete Streets Coalition, in the last 20 years, hundreds of jurisdictions across the United States have adopted Complete Streets policies, directing their transportation agencies to routinely plan, design, build, and operate safe street networks for everyone. FHWA states that 2/3 of the states and many jurisdictions have gone on to create Complete Streets design models, transforming their project development processes to prioritize safety for all. Historic practices have focused on the addition of Complete Streets elements to projects. The emerging practice at NDOT is to start with the Complete Streets as the default approach and only remove elements when they are unwarranted. I would like to talk now about the steps the department has taken to institutionalize Complete Streets as the default approach. NDOT's traffic safety engineering team developed the department's first Complete Streets policy in 2017, recognizing the impact that Complete Streets had on the reduction of roadway-related fatalities and serious injuries. The policy acknowledges the need for a tailored solution that considers specific corridor and community characteristics, which are informed by factors such as land use, travel patterns, and impact from local stakeholders. It's important to note that the public participation with stakeholders is imperative. What we do in rural Nevada often looks differently than what we do in urbanized areas, and that's why it's important to seek input from all different stakeholders, whether they live in the community or they're traveling through. By prioritizing safety and accessibility while promoting sustainability, transportational choices, Nevada aims to create vibrant and inclusive communities where economic vitality, quality of life are enhanced through the planning initiatives. Promoting active transportation not only encourages physical activity, lowering obesity rates, and improving overall health, but it also enhances safety by reducing traffic-related injuries and fatalities. I bring up the health components in relation to Complete Streets because I want to thank you for having this joint committee today and understanding the overlap. I often like to give the example when I work with Safe Routes to School programs that when students walk and bike to school, they arrive to school with their bodies being active and ready to learn. And that's why I walked here today. Additionally, it improves air quality by decreasing vehicle emissions, supports community access to essential services, and fosters social interaction through inclusive street designs that promote gatherings and outdoor activities, ultimately creating healthier, more connected communities. I do want to point out that we have a typo on this slide. In parentheses, the CDSA should be CSDA, so pardon me for that. So NDOT formed the Context-Sensitive Design Approach, CSDA, known as the CSDA Group, in response to the 2017 Complete Streets Policy and included direction from Senate Bill 285 and Senate Concurrent Resolution 5 from the 2021 legislative session. The CSDA Group includes several disciplines and was comprised with planning, design, multimodal, and safety experts. The purpose is to conduct a holistic assessments of roadways projects. The CSDA Group was the department's first step in moving to a people-centric focus. Initially a standalone, the CSDA Group is now integral throughout the design process, ensuring projects align with comprehensive transportation standards. Current design practices start with scoping process, where the safety and multimodal experts provide needs and studies to support the incorporation of all modes. These experts are part of the project team as it progresses through the design, championing needs as early in the process as possible, and we call upon these processes and provide solutions when the project manager identifies potential funding or construction costs and risks. This transition started in 2023, and NDOT is looking forward to building projects under this integrated design process. We are aiming to update our Complete Streets policy. The policy will address Nevada's evolving roadways needs amidst ongoing growth and solidify practices developed from the context-sensitive design approach, which I just talked about. It will be based on national best standard practices, including the FHWA Complete Streets policy, but will be tailored to meet Nevada's unique transportation needs. The policy will offer tailored options for Nevada's rural and urban areas, incorporating consistent transitions and the context-sensitive elements to enhance safety and usability. The policy will be rigid enough that it ensures that all users are considered, but flexible enough to understand that there are different needs throughout the state. Undeveloped areas are unlikely to have multimodal needs, but they may change, and as development needs occur, the changing the context and the user needs is what we need to reevaluate. While designed for NDOT, this policy will be shared with local agencies to ensure that projects are coordinated and meet road user expectations. The department is currently pursuing the federal grant through the Active Transportation Infrastructure Investment Program to complete this work, and will not only update the Complete Streets policy, but it will also develop a statewide active transportation plan that will guide the inclusion of active transportation elements across Nevada's network. We are very excited about this funding opportunity. This last slide, I'm not going to read all the boxes, but I do want to take a moment to emphasize what they mean to NDOT. NDOT's leadership in the transportation policies are imperative, and NDOT understands that it plays a central role in shaping local transportation policies through collaborative partnerships with municipalities and stakeholders. The department intersects both locally and figuratively with local agencies and tribal partners. Collaboration is key as the traveling public expects and deserves a transportation system that is consistent and intuitive. Standards uphold uniformity and excellence across all transportation projects through the state. Resources assist local communities in surmounting financial obstacles to implement transportation enhancements. Through cohesive collaboration, we guarantee that transportation initiatives align closely with the community needs and priorities, and by enhancing operational efficiencies, we optimize effectiveness and overall community and mobility accessibility. This concludes my presentation, and like I mentioned, I have colleagues here, and I'm happy to answer any questions that you may have.
Committee members, do we have questions? Assemblywoman Brown-May.
Thank you, Chair. There's been a little bit of work in the interim done with regard to local community settings. You talked about a complete street. Complete streets are different depending upon who is in the conversation about what a complete street is. So I'm wondering if you could go back and walk us through that just a little bit. In Las Vegas, we often have 6 lanes of traffic with a bus lane and a shared bike lane and a median, which divides both sides, say east and westbound. That would be considered a complete street in that it has a sidewalk for pedestrian access, it has a bus transit, it has bike accessibility, and it has a roadway design. What you just showed us was in a very small town, right? How you have a complete street in a neighborhood. And so are there specific elements to make a street complete even if it's very small? That's number one. And number two, the recommendation comes from NDOT, right? So do we have authority outside of state routes for complete street development? Is there any collaboration with local municipalities to work on streets that don't belong to NDOT?
Thank you for the question. For the record, Rebecca Capular. I am going to attempt to respond to you, and then I will hand it over to my colleague, Lacey Tisler. With the complete streets, what we're really trying to do is make safe spaces for all road users. So it looks like it could be different in every community. And as the previous presentation did talk about, you know, City of Las Vegas, for example, in Clark County, they have a lot of streets that are very wide, that have higher speeds, and doesn't look like what that photograph I showed you from Ely. That's very good. And the other part of it is, when I mentioned that we have to have stakeholder involvement, we can't just go in and change a community. We have to have ownership. We have to have people in support of it, whether it's from law enforcement up to politicians to the road users itself. So we do have a lot of conversations, and we try not to come in and just put things out there that people don't want or don't use, but we have the complete streets policy to set that stage and help guide us. And I do believe as we evolve this policy and create our active transportation plan, it's going to help us with creating a design element. For example, what does it look like on a 40-mile-per-hour road versus a 25-mile-per-hour road? And we don't have that implemented right now in any type of policy, and so that's why we're really excited about this opportunity to get started on our statewide active transportation plan and update that complete streets policy, because it will give us more driving forces to help us, if you will, to get there. But if you're comfortable and available, Lacey, I would like to hand it over to you to see if you'd like to add anything.
Lacey Tisler, Nevada Department of Transportation. To echo Rebecca, complete streets are not a one-size-fits-all solution. Nevada is such a big and diverse state. We have our entertainment district in the middle of Las Vegas, and we're out here. I'm in a rural town in Elko right now. We have main streets going through rural towns as well. The complete street in a rural main street should not look like the complete street on the 6-lane facility that Assemblywoman Brown-May was speaking about. This complete streets policy is intended to build a kit of parts for the one that makes the right sense in the environment and allow an opportunity for the community to be seen and heard, because we need to understand the way the community moves to make sure we're recommending the right facility. In addition, our MPOs and our local partners will be involved in this conversation, because our roads intersect literally and figuratively. Our users do not know the difference between whose road they're on. So being isolated in this conversation wouldn't serve the people who use our roads.
Thank you for that. I appreciate the clarification, and also really would look for your leadership with regard to engaging the local municipalities so that we have uniform expectations when we look at refurbishing existing development, so that we can move more toward that safer, walkable, bikeable, user-friendly community, right? And so that you're not isolated and only looking at state routes, but how are we really building our communities to be safer for all of our users? To your point, people don't know when they're on a state route versus when they're on a local road, and so I think that has created some confusion in our local communities. So thanks for your efforts.
Vice Chair Watts.
Thank you very much, Chair. Thank you for the presentation. So I see in some of the slides with some of the elements of complete streets, it mentions street trees and green spaces. It also mentions street furniture and amenities. And I see a lot of things that kind of point towards some of these things, including the various health benefits. But I think it's important, given that some of the other topics that we're going to be hearing about today, that we think specifically about extreme heat and how that impacts walkability, multimodal use, particularly in our urban areas. And so I guess my question is, as you're looking at, coming up with this updated outline, how do you think about the use of trees and the use of shade structures, not only for kind of the benefits that they might provide at a bus stop or the kind of creation of green space, but particularly in terms of reducing extreme heat and improving kind of the usability of sidewalks and other infrastructure along different streetscapes.
Thank you for the question. For the record, Rebecca Capular, NDOT. I think you bring up some really valuable points that we can definitely look at as we develop the next phase of our Complete Streets program and policy. Last year I was watching the news, and I live in the Reno-Sparks area, and I saw there was a gentleman, to your point, that was waiting for a bus, and it was super hot in Las Vegas, and he sat down on the sidewalk because there was no shelter or benches, and he ended up getting hospitalized with second-degree burns on the backs of his legs. I like to believe that I'm a pedestrian and safety advocate, and I walk the walk, if you will. And so recently some of my colleagues were going to Vegas, and they were like, oh, it's going to be so hot down there. And I just said, well, remember that when you're driving and you pass somebody who has no other means of transportation besides taking the bus or on foot or on bike. So I think these are all really important elements, and we will definitely look at all different of these aspects as we develop our plan and see how we can make that happen. Yesterday I was talking to someone in Elko who's from the Las Vegas area, and they were saying it was 120 degrees. And I don't know about you, but I don't like that kind of heat myself. And it's definitely, we have climate change coming, and I believe it is human involved, and anything we can do to eliminate and make things better for our road users, I think that would be something we can definitely look at.
Thank you. I appreciate that. And as somebody who grew up in Las Vegas and especially in my youth, did some walking on some 110 plus degree days. It's not very fun. No. And, again, both for the people who don't have any other options, but also if we're trying to encourage different modes of transportation, we know that summer is long and hot here, but the more that we take action to provide a more pleasant environment for folks to walk and bike. And again, it's not just about having sidewalks and bike lanes, although those are definitely important. It's also about facilitating that comfort through the creation of shade and kind of extending the season and the conditions in which it's a little bit more pleasant to take advantage of those. So Anyway, I really appreciate your response and look forward to seeing what comes out of this process.
No problem. And one thing I want to add is RTC of Southern Nevada has done a study on heat islands, and they are looking at working how to incorporate into transportation planning. And so I know that our partners are looking at that, and we work very closely with our partners, and we will see what we can do to mitigate and work closely with them.
Okay. I have, I believe, does Ms. Tisler have a response here?
I would like to add to Rebecca's response. Thank you.
Yeah, of course.
Nevada Department of Transportation. I'm sorry for the awkwardness on Zoom. Assemblyman Watts, I want to just emphasize what you were saying, what Rebecca was saying. It is important for us as a transportation agency and for everybody who uses and makes recommendations on the system to understand and feel and experience what the users experience. So recently on one of our trips to Las Vegas, we chose to take the public transportation system and did experience the heat and did end up missing a bus. And we are incorporating that into our recommendations and decision making.
Great, thank you.
Okay, my question is, what can we, as the state legislature, do to support the work that NDOT is doing with regards to the Complete Streets program?
Thank you. For the record, Rebecca Capular. That's a really good question. I'm new in my role, as I mentioned, just 3 months in, and what I'm seeing through my fresh eyes is we hear different things from different communities. For example, we might hear the residents saying, we need to slow speeds, we need this, we need some infrastructure. But then as we move forward, we're not getting support in some cases, not all the time, from some of the policymakers. Some people might feel that they don't want to slow down. So anything that you can do to help support the message of why we need to slow down speeds and have safer communities for all road users would be very helpful. Education, it's part of it, and outreach and talking about it. Personally, I know that if we slow a roadway for 2 miles, maybe from 55 to 35, because it's through a community, especially in those rural areas of our state, does that really slow us down that much? It doesn't, and so having those conversations I think is really helpful, and just helping us progress and support what myself and you'll hear from our colleagues and other road users and owners today to help us continue to move forward with our goal.
All right. I don't think we have any more questions for you. Thank you so much for coming and presenting today. We'll go ahead and close out agenda item number 5 and open agenda item number 6, which is presentations on Complete Streets initiatives and walking audits. We will have representatives from the RTC of Washoe County and representatives of the RTC of Southern Nevada. I believe we're going to take one at a time. And since we're in the north, we'll start with Washoe County. Good morning still, technically. Thank you for being here. Go ahead and state your name and begin whenever you're ready.
Good morning, Chair Harris, Chair Giannate, members of the committee. Thank you for having us here today. My name is Paul Nelson. I'm the Government Affairs Officer at RTC Washoe. And we're going to discuss some of the things that we're doing as part of our Complete Streets program and also how we're using Complete Streets funding. So as far as Complete Streets funding goes, RTC Washoe does receive monthly payments from the DMV. Since January 1st, 2019, so for about 5.5 years, we received more than $367,000, And we use that funding for things like bicycle lanes and routes, facilities, signs for construction and maintenance of roads. And since 2021, when we started the Audie Wells project, that's where we've been using this funding. As far as the RTC Complete Streets program, when we go in and do any project, we really look at the road in its entirety, not just looking at cars, but also looking at how we can improve it for all users of the road. So we look at designing roads for users of all ages, modes, and mobilities, the potential to improve safety, economic development, and the quality of life for neighborhoods. And it enables safe access for pedestrians, bicyclists, motorists, and transit riders. So our revenues that we get at RTC Washoe, you can see about half of our funding comes from local fuel taxes, and that goes towards road construction. About 22% comes from sales tax, and that goes towards public transit. Then we also have some federal funding, passenger fees, funding from the state, and then from other sources as well. So one of the things that we do at RTC Washoe is we are the Metropolitan Planning Organization. So right now we're working on our regional transportation plan, and that's the long-range outlook, what we can do in the next 25 plus years to improve our transportation network. So what we do is we go out into the community, we get their input, we find out what their vision is of what we want transportation to be like in the future, and then we look at how we can implement different projects, programs, and services necessary to achieve that vision. We plan on having this completed in the spring, and this could be implemented by the RTC, by NDOT, and by other member entities. One of the things that's part of the RTP is our active transportation plan. We call that Walk and Roll Truckee Meadows. And this is really what we're talking about with some of the complete streets. It really focuses on improving the walkability and the bikeability throughout Reno and Sparks. And it looks at a neighborhood level. We're looking at all kinds of different neighborhoods and seeing how we can improve the walkability and bikeability. It's for people of all ages. It looks at sidewalks, looks at bicycle facilities, and then it also looks at existing data. Things like transit, equity, safety, and the bicycle level of stress, and the pedestrian experience index. How comfortable do people feel while they're riding their bike on some of our city streets? So community investment, we do a lot of investment when it comes to planning, public transportation, and construction. And just last year, that investment led directly to more than 2,600 jobs in our region. Some of the recently completed projects that we've done that we have taken an overall look and used this Complete Streets program. One of them is the Sky Vista widening project. We finished this in December. We expanded this, what used to be more of like a rural type of road, 2-lane road. We expanded it to 4 lanes, but we also made it safe for everyone else that uses the road too. It was a capacity project, but we also made it safer. So one of the things that we did was we created a roundabout at the entrance of North Valley's Regional Park. One thing that roundabouts will do is it slows traffic down, so there are fewer crashes at roundabouts, and if there are crashes, they're generally a lot less severe because cars are going slower, and you don't have those head-on collisions, you don't have those T-bone collisions. As far as the complete streets go, we also put in street lighting, wider sidewalks, and put in bike lanes. One of the nice things about this project was not 1 cent of taxpayer funding went into it. It's paid for by regional road impact fees that developers pay. Another roundabout that we put in that makes a corridor much safer is the 4th Street and Woodland Avenue roundabout. This was an area that we saw a lot of speeding happening, and it made things really, really difficult for bicyclists and pedestrians, but also it made things difficult for people that were trying to enter onto 4th Street from Woodland Avenue and from Mesa Park Road. So we put in this roundabout and a retaining wall on below Mesa Park Road on West 4th Street. It not only made the roadway improvements by putting in the roundabout, but it also improved safety for people riding their bikes. There's an 8-foot multi-use path there. There's also bicycle facilities and crosswalks. One thing that we did over on Mesa Park Road was people used to have to, when they were turning left, they had to go through 2 lanes of traffic that were going at high speeds. That's only a right-hand turn now, so now they just turn right, they go up around the roundabout, and they're back on their way. So this one was also paid for with regional road impact fees. I mentioned the Audie Wells project earlier, and this is where we've been using our Complete Streets funding. This is a 3.2-mile roadway that goes from Sparks to Reno, from Pyramid Highway over to Interstate 80. And this is a project that we're really proud of. It's an underserved area that really didn't have any kind of facilities for pedestrians and bicyclists. We've changed that. We've gone in and we've put in 6 miles of raised cycle tracks. So each side has a raised cycle track. We've got 490 new trees, 433 new lights, privacy walls in select areas, and we've also put in sidewalks. For people that remember this before this project, it wasn't unusual to see people that would be walking through parking lots or on the side of the road or in wheelchairs going through parking lots on the sides of the road. Now they've actually got facilities that make it a lot more safe for everyone that uses that roadway. Good news is we're almost done with this project. We're just weeks away from the completion, and we hope to have a ribbon cutting sometime this fall. Another one that we looked at was Holcomb Avenue Rehabilitation Project. With rehabilitation projects, this is fixing the pavement, going in and rehabbing the pavement. But when we went in here, we looked at Holcomb Avenue and we thought, how can we make this better for everyone else? So one of the first things we did was where Sinclair Avenue intersects Holcomb Avenue, that used to be kind of a V-shaped intersection, and it really made it unsafe for drivers and pedestrians because you'd have people entering onto Holcomb almost like an on-ramp on a freeway. So they'd be looking over their shoulder to see if there's cars coming, not looking in front of them to see there's a pedestrian right in front of them. So we changed the configuration of that intersection. Instead of that V shape, now it comes into the street as a right angle and makes it a lot safer for the drivers and the pedestrians. We also reduced we took out the center turn lane, maintained roadside parking. We have bike lanes, and we also added a buffer lane between the cars and the bikes. And we also made some improvements for ADA accessibility. Some of the ones that are happening this year, right now, the South Virginia Street I-580 Exit 29 project, that's happening right now. That top picture right there that you see is the off-ramp, northbound off-ramp. And that tends to get backed up quite a bit because traffic on Virginia Street is so busy. So what's going to happen there is we're going to be putting in a traffic signal and adding a second right-hand turn lane. With that will also come some pedestrian facilities and bike facilities. If you look at that bottom picture, we're going to add one more northbound lane on Virginia Street, but there's also no sidewalks on that east side of the street, on the right-hand side. So we'll be putting in a sidewalk on that side, some bike lanes. It's going to really improve this corridor, not just for traffic flow, but for people that need to walk there, need to bike there. Just a few blocks away, there's a lot of apartment complexes here, so a lot of people do walk and bike down to the different shopping and restaurants in this neighborhood. There will also be some improvements to the intersections where South Virginia crosses Patriot and Longley. Some upcoming street and highway projects next year. The Virginia Bus Rapid Transit line, we'll be making some improvements on that. The top left picture that you see there, when we first built the BRT, these bus stops were built for much larger buses that we were using at the time, those big articulating buses. We realized those buses were a little bit too much for this route, so we came back down to these standard buses. But you can see now that ramp that comes off the bus isn't flush with the platform. So we'll be reducing the height of that platform to make it a lot easier for people with disabilities to get onto the bus, and also to reduce any kind of tripping hazards for anyone else that's getting on the bus. The bottom picture there you see is what we call a mini BRT station. We're going to replace all of those with full-size BRT stations. And then on the right side, we've got a plan to put in bus-only lanes between Peckham Lane and Plum Lane, and that'll improve the efficiency of the BRT system. Another important upcoming street and highway project that we have going on is the Downtown Reno Micromobility Project, and we've identified 4 different routes where we're going to make a lot of improvements to the bike facilities. And one of the main reasons for this, safety, obviously, but when you look at Vine Street, Virginia Street, and then Lake Street, it really connects Old Southwest and the Midtown District to the north side of Interstate 80, especially up there by the University of Nevada. So this is a really important project, not only to get people out of their cars and out of their bikes, but also to offer a healthier option for people to get around town. Another important project that we have coming up is the Sun Valley Boulevard project, and this runs from Scottsdale Road to 7th Avenue. This is it's very lacking when it comes to bicycle and pedestrian facilities. This picture here, you can see there's no bike lanes, no sidewalks, no drainage. You've got a ditch there. So you'll see people walking on the sides of the roads. You'll see people walking in the ditch sometimes. So the plan with this is to fix all that. We want to improve the sidewalks, build sidewalks that'll include curb and gutter and the drainage. It'll be a pretty heavy lift, but we're going to be looking at some federal funding, possibly the RAISE grant. We've got some other grant options that we're looking at as well. And this could also make some improvements to some of the transit stops that are along this route. This is one of the busiest transit routes that we have in the Reno-Sparks area. So last April in 2023, NDOT conducted a road safety audit on South Virginia Street between Patriot Boulevard and Mount Rose Highway. And it identified traffic safety issues along the corridor and suggested measures to improve the traffic safety and reduce crashes, focus on FHWA safe system approach, and it was conducted as a safety management plan. And then finally, the walking audit that was conducted in August of 2023. This was led by the Northern Nevada Public Health, and it was focused in Sun Valley, particularly right around Sun Valley Boulevard, and then also Sun Valley Park. So if you look at these two pictures, you can see this is one of those other underserved areas that we were talking about where there's really not a lot of options when it comes to walking and biking. That top picture, you've got a paved road and a little dirt path that people walk on, and not a lot of space between that roadway and the ditch. And then that bottom path, that's on the east side. Sure, you've got a wide gravel shoulder along that road, but it's really subpar when it comes to pedestrian traffic and bicycle traffic. So this is an area of focus that, as I mentioned, Northern Nevada Public Health did, but they shared it with Vision Zero Truckee Meadows Task Force, which we are a part of. And we will use that feedback as part of our active transportation plan that we're working on right now. That concludes my presentation. Thank you for listening, and we'll open up for questions. This is also, to my left here, is Graham Dollarhide. He's one of our planning managers, and he can answer some of the questions. And then also behind me is Dale Keller. He is our Deputy Executive Director.
Okay, I believe we also have the representative from the RTC of Southern Nevada online, and I think the most effective way here, if you all don't mind hanging out, would be to have him do his presentation, then I'll allow the committee to ask questions of all of you, if that's okay. All right.
Good. Okay, so I'll share my screen real quick. Okay, good morning, almost afternoon. For the record, my name is Andrew Kelman, Senior Director of the Metropolitan Planning Organization at the RTC of Southern Nevada. Thank you for allowing us to present today and provide an update on walking audits and our Complete Streets projects. Before we begin, I want to briefly share who the RTC is and what we are responsible for. We provide public transportation, operate the bike share system in downtown Las Vegas, and are the federally designated Metropolitan Planning Organization for transportation planning. We also administer local roadway funding on behalf of our member entities and are the region's traffic management agency. So we are the transit agency, NPO, and traffic manager all under one roof. Let's take a look at how the RTC serves Southern Nevada, and first I'll discuss some of the transportation impacts on health. The RTC recently completed a study to better understand the connection between transportation and health. Part of this study included the development of the Transportation Health Index, which is a tool to better integrate health into our decision-making process. This index includes over 30 factors and scores each of those factors based on local conditions on the ground. The 30 factors can be roughly grouped into these three broad categories. The first is health vulnerability, and this includes identifying areas in Southern Nevada with higher chronic health conditions like diabetes, heart disease, obesity, asthma, and it also includes social equity factors like race and income. The second category in the middle is access to transportation infrastructure, and this includes things like good, fast, frequent transit, sidewalks, and bike lanes. And the final factor includes transportation-related health risk. This includes data on traffic safety and crashes, vehicle-related pollution, extreme heat, levels of green space and street trees, and higher levels of inactivity due to the built environment. And when I say the built environment, I want to briefly explain what that is. This slide displays some of the common measures when describing the built environment. Large portions of Southern Nevada can be characterized by suburban development with lower residential densities. Land use diversity in the middle refers to separated land uses, meaning that residential areas where people live aren't always near commercial areas or job centers where they need to go. And finally, street network design refers to neighborhoods that have cul-de-sacs, or really any street network that induces longer trips, so they aren't well served by walking or bicycling. And so when you combine these factors, they result in more driving and less daily physical activity, leading to negative health outcomes. And these built environment factors are included in our health index, and we map them for the entire region. And here's the final health composite index map. Areas in red have greater health concerns and higher vulnerability based on socioeconomic factors. Areas in red also have lower transportation access and are also overburdened by the impacts of the transportation system. From the map, you can see that there are areas where more health-focused transportation investments can have a greater impact, like complete streets, more green space and street trees, improved traffic safety, and reduced pollution levels from transportation. The RTC references this map as we prioritize projects for funding, and our member agencies are using it as they seek federal discretionary grants. Next, I'm going to highlight a study that helped increase the awareness of extreme heat in our region and informed our actions that aim to address the urban heat island effect and increase climate justice. In Vegas, not only is it hot, but it's gotten hotter over the past few decades, and it's grown at an alarming rate. According to studies, Southern Nevada is the second fastest warming metro in the US, second only to Washoe County, since 1970. And studies predict that it will continue to get hotter in the coming decades. One campaign the RTC recently completed was through a grant received by the National Oceanic and Atmospheric Administration. The grant was used to organize volunteers who drove around Southern Nevada with temperature and humidity sensors on their cars to capture real-world temperature data. Before this effort, the RTC utilized temperature data from satellites, and it wasn't neighborhood or roadway specific. Through this campaign, we captured about 140,000 temperature measurements spread throughout the valley on the same single day. And here's the final map showing the distribution of heat across our region. We have this map available on our website at rtcsnv.com/heatmap. The map is fully interactive and can zoom right down to the neighborhood and street level. And as we see, similar to the previous map, heat also isn't evenly distributed across our region. Areas on the east side have higher temperatures due to lower elevations, less green space and street trees, and lots of roads and buildings that soak up heat throughout the day. One area where the RTC has taken a proactive approach to turn this research into action is through the placement of new transit stops. Of the RTC's 3,695 bus stops, 1,658 of them have a shelter, which means there is shade at that bus stop. So almost half of our stops include shade. And we know that transit riders are more exposed to extreme heat and less able to adapt to it as they wait for our buses or walk to and from our bus stops. And providing shade can have a really big impact. It's up to 20 degrees cooler in our transit shelters as opposed to not having a shelter. As the RTC rolls out new shelters, we are prioritizing their placement in those areas that have been identified as the hottest in the region through our volunteer mapping campaign. Now, I'd like to transition to talking about the RTC of Southern Nevada's efforts on walking audits. Nevada Assembly Bill 343 from the 2021 legislative session required the RTC to develop a walking audits plan that emphasizes the importance of pedestrian infrastructure. The intent was to ensure that there's a systematic approach to evaluating and improving roads for people walking and rolling by increasing safety and accessibility and ultimately developing healthier communities. This bill required the RTC to conduct one audit a year and a requirement to post it online. The good news is that the RTC of Southern Nevada is doing a lot more than one walk audit a year. In partnership with the Southern Nevada Health District, we created a website where we explain what a walk audit is, posted our plan for conducting audits, and identified the locations where walk audits have already occurred, and next steps for conducting future audits. There's also an opportunity for the public to suggest potential walk audit locations that we can get to in the future. And a brief primer on what a walk audit is and how we implement them in Southern Nevada. It's an organized visit to a street to assess how supportive it is to walking or rolling. Walk audits are best conducted by a diverse group of people to ensure all perspectives and the different ways people move about our community are captured in the audit. The goal is to document if the street is safe and comfortable to walk, and if it's not, to identify the needed improvements and projects for future implementation. Previously, the RTC partnered with CCSD to conduct 65 audits around elementary, middle, and high schools. And just last year, the RTC completed audits around Nevada State University and 3 additional audit locations throughout the region. The project website developed in partnership with the Health District displays where the most recent walk audits have occurred and where they are planned next. Currently, we have 20 walk audits planned to be performed in just the next year. And finally, the findings of walk audits make their way into recommendations to implement Complete Streets. Complete Streets programs are being implemented under NRS 403.575, which ensures roadway projects consider all users, ages, and abilities of the transportation system. Complete Streets projects improve public health through increased safety and by encouraging greater physical activity. To briefly highlight one of the RTC's role in implementing Complete Streets, the RTC is responsible for the day-to-day administration of funds collected locally through the motor vehicle fuel tax and sales tax, and this includes fuel revenue indexing. We work with our member agencies to administer local funds for the design, construction, and maintenance of the transportation system, which includes constructing new Complete Streets. And through this process, this graphic displays the total number of projects the RTC has been able to start in partnership with local jurisdictions and industry. We have been able to start 666 projects since fuel revenue indexing was initiated in 2014, of which 436 of these projects have been completed, and another 119 are currently in construction, and another 111 are in design. And each of these projects includes different elements of Complete Streets as an overall goal of the project. And now I quickly want to highlight some Complete Streets projects that are being implemented by each of our member entities. The first one is from Clark County on Ann Road in the Northwest Valley. This project included new sidewalks, buffered bike lanes, street lighting, and a center median island to slow vehicle speeds and control left turning access. The next Complete Streets project is in the city of Las Vegas on Main Street, which introduced a one-way couplet system, wider sidewalks, buffered bike lanes, lighting, and new street lights. The next example is a North Las Vegas project on Camino al Norte that repaved the roadway and created new buffered bike lanes. Another upcoming Complete Streets project is the City of Henderson will construct the Reimagine Boulder Highway project. This project will add much more lighting to the corridor, include wider sidewalks, protected bike lanes, additional street crossing locations, and dedicated transit lanes for RTC buses in the center of the road, along with newer and much larger transit stations with increased shade. And so this project is a combination of being federally funded and locally funded with RTC funds. Another RTC-funded Complete Streets project is in Boulder City on Veterans Memorial Drive, where a repaving project removed a traffic lane in each direction to slow vehicle speeds and create more space so a buffered bike lane in each direction could be added. And finally, in Mesquite, a new roadway was constructed on Oasis Boulevard that, in addition to making it a complete street, constructed a roundabout, which have been proven nationwide to increase safety by reducing vehicle speeds and associated serious injuries and fatalities. And that concludes my presentation, and I'm happy to answer any questions you may have along with RTC Washoe.
Okay, I believe we will start with questions from Senator Hansen.
Thanks, Madam Chair. First of all, for Reno RTC, you guys do a great job. I got to tell you, I'm really pleased. I've been driving on the roadways with a license since October of 1976. The road network in Reno Sparks area is great. Two questions. One, the fuel indexing and the amount 50% of your budget is from fuel taxes. I noticed when I come down into Carson City, it's probably 25 to 40 cents cheaper here. What is our actual tax, RTC tax, that people pay in the Reno Sparks area per gallon?
Good afternoon now. Dale Keller, Deputy Executive Director for RTC Washoe County. Senator, to answer your question, I don't have the exact number for you, but Washoe County and Clark County has the indexing of fuel, and that's why you see that differential between the gallons, the dollars per gallon between here and.
Well, I know, and I honestly, it's a good program. The dollars are being well spent, okay? And since it's a user fee, it's a good, people don't have to pay the tax who don't use the road network, basically. So that's been a really good one. I'm just curious as the amount, because obviously down here, like I said, I've noticed a lot of the employees that work down here that live in the Reno area seem to fill up down here more than up there. Can't blame them for that. Question though, Pyramid Way, you guys have a project going on out there. Got a bunch of complaints because the murals that are set up to block the neighborhoods has a fish design, and apparently they got it all messed up to where I got a bunch of complaints because it isn't a continuous looking thing. Are you guys aware of that, and what is the status of repairing that? That is a project that's ongoing. I didn't think you mentioned it, but I have got a lot of complaints, and it sounds sort of silly, and it honestly does make a little bit of an incompetency thing when the mural doesn't look, you'd have to see it to know what I'm talking about, but it looks funny.
Senator Hansen, Dale Keller, RTC Washoe. That is a Nevada Department of Transportation project.
Not you guys then. Okay.
And we are working with them. My understanding is that they came up with a solution that would meet the community's expectations.
Okay, well, I saw NDOT on it, but I also saw RTC, so you guys are doing something in conjunction. Other than that, just want you to know, I think the fuel tax thing, I realize that, people typically like me aren't big on taxes, but the monies that are being raised are being very well spent. Road network's in great condition in our area, so I salute you for that, and I think it's a very good use of our tax dollars. So thank you. If you work on that Pyramid Way thing, or the NDOT folks are the ones I should have talked to, my apologies. But anyway, keep up the good work. Thanks, Madam Chair.
All right, we will now go to Vice Chair Watts.
Thank you, Chair. Great to hear my colleagues' enthusiastic support for fuel revenue indexing. I agree, it's a great program. So I have one question specific to RTC Southern Nevada, and RTC Washoe County provided the amount that they get from that, from the DMV, from the optional, I think it's a $2. So I was wondering if RTC Southern Nevada could provide, if you know what the amount is that you receive from that, either on an annual or total basis. And then if either of you happen to know what portion of folks that do their registrations actually opt in to provide that $2.
Yes, Andrew Kelman, RTC of Southern Nevada. I don't have those numbers in front of me, but I know we do have them, and we can provide them very quickly.
Great. And does anyone happen to know how many registrants actually provide the $2? If not, I'll follow up with the DMV.
No, sir. Dale Keller, RTC Washoe. No, sir, we do not.
Great, thank you.
Okay, we now have Assemblyman Nguyen.
Thank you, Chair. My question is also for the Southern Nevada
folks. Looking at your slides when you walked over, or you went over the walk audit log, I just noticed on the map that southwest of the valley was pretty uncovered, or even a certain part of the east as well. Were there any thoughts behind why that complete area was not part of the audit?
Sure. Andrew Kelman, RTC of Southern Nevada, for the record. I think if we were to go back and holistically look at the audits that we've done before AB 343 was implemented, I think we would have some areas in the Southwest that we could add to that map. What that map is showing is since that bill passed, what we've done since then. One of the tactics that we do try to do is we try to tag team a walk audit when we already have a transportation planning study going on in that area. And so that's some of those dots that you'll see on that map is where we already had an existing study identified. But the comment is well noted. We do want to spread this out throughout the valley and get feedback from the community where they want audits to occur in the future.
And just to follow up on that audit part, in terms of the community, are there external community members involved with that audit, or this is just done purely internally by RTC staff only?
Yes, Andrew Kelman, RTC of Southern Nevada. We definitely want community participation. I think we view them as really two things when we do a walk audit. Part of it is community engagement, engaging the public about what they want to see in their roadway system and making them aware of some of the challenges of the transportation system. And we really want diverse participation. So that's moms, that's kids, that's people walking and rolling, have mobility impairments. So we want a really diverse group who goes out and conducts those audits. And so we will solicit community participation before we go out and do an audit. And then we also pair that with traffic engineers and transportation planners as well.
Yeah, I would love to learn when those opportunities are available. So if you could get that to us, that would be great. And then I think my last question would be reflecting on what Vice Chair Watt said earlier, of our heat rising, and we have a lot of, heat issues now. When you display that slide about how the shelters are only half of the actual stops, are there plans to make that those shelters being close to the number of stops that we have?
Yeah, Andrew Kelman, RTC of Southern Nevada, for the record. Yes, we try to get as much resources as possible to deploy more shelters. We have kind of three different shelter programs going on right now. We have our general market shelter, which you probably see out on the street right now. We've redesigned its roof to increase shade. We've also started deploying our slimline shelters that we can get in places where normally we would have to get an easement from the private property owner. We can now fit these slimline shelters on a regular sidewalk and still maintain our ADA clearance. And then we also won a grant from the Federal Transit Administration to design a new shelter, and we're calling these our climate adaptive shelters. And so once those are designed, we plan to roll those out as well. But yes, we implement shelters as much as we can as resources are available. And we are really focused on deploying them in those extreme heat areas because that's where they can have the biggest benefit. And that's where we see a lot of our transit ridership as well.
Great. Thank you for your answers. Thank you, Chair.
Okay, we will now go to Chair Dunyate.
Thank you so much, Chair Harris. This question is more directed towards RTC of Southern Nevada. With the slide referencing the Health Composite Index, can you break this down just more in simple terms of what we're actually looking at? I would presume that, I'm assuming the shades of blue signify that there's, I mean, those are probably the newer parts of town, so they have better infrastructure versus more of the infill parts of the city. Is that correct? Am I reading that correctly? Or how would we, like, if you can break down the map, I think that would be helpful.
Yeah, Andrew Kelman, Southern Nevada, for the record. So what that map is in front of you, that is all 30 factors combined. So it's really difficult to pick one out and say that's what's having the impact in that area. I think what is helpful is to look at the report, which I can provide. It breaks down each of the 3 different overall groupings into a single map. And so you can see where underlying health conditions are having the biggest impact. And then you can see where the transportation supply is having the biggest impact, meaning maybe a lack of transit, sidewalks, or bike lanes. And then the final one would be those factors of the built environment that I was talking about, kind of like your land use density, your street network design, and how your zoning has mixed uses or not. So I think if you look at those 3 in broader categories, I think that could help break down the map a little bit.
Thank you. If you could send that report, that would be great. Another follow-up specifically to you. I know earlier we talked about reducing fatalities throughout the state, and part of the strategy that we've seen in other states is, of course, incorporating mass transit. So what are obviously, when we talk about mass transit infrastructure, there's obviously the biggest question is how do we pay for it? But what are some of the strategies that we're looking at specifically in Southern Nevada to improve mass transit? And then more of a personal question, what do you feel is necessary in order for us to reach the demand that we need to evolve towards if the city continues to grow and if our state continues to demand it?
Yeah, Andrew Kelman, RTC of Southern Nevada, for the record. Yeah, I think transit is a very safe mode. I think data shows that traveling inside a transit vehicle is much safer than driving or walking or biking. So transit in general as a mode is very safe. And I think as we have the resources available to us to increase transit service and get more ridership, I think that'll make our transportation system overall safer. In terms of looking at different roadway designs and different options for upgrading our transit service to bus rapid transit or even light rail, I think one of the benefits of those projects is that at the same time, you can redesign the street for wider sidewalks, better bike facilities to help slow vehicle speeds and increase the safety of all roadway users.
Thank you. I greatly appreciate that response. I think that, both Assemblyman Watson and I both have a district that, with the Maryland Parkway initiatives, I think we obviously get a lot of recommendations, of course, to improving mass transit. And we were definitely interested in some of the improvements that are happening. So I hope that we can continue to have this conversation, especially as our city continues to grow. And then this is more so probably a question for all of you. I know we've talked about the fuel tax. My colleague mentioned it earlier. Have you had any discussions or any thoughts about, there's obviously the concern that as we have more electric vehicles that they're not paying into some of the funding revenue structures that we have. So do you feel the legislature has arrived to that point where we have to have this discussion? Or have you done some analysis of the potential funds that we're not capturing yet that could be reverted back towards improving our infrastructure? I'm assuming you guys have had this conversation, so I'd appreciate your feedback on that.
Dale Keller, RTC Washoe. I'll kick it off, and then I'll let my colleagues in Southern Nevada weigh in as well. It is a concern, and it is a challenge as we look through for the future of transportation funding. We continue to work with our colleagues at the state, with NDOT, the DMV, as well as Southern Nevada and industry partners, as well as the state legislature, about understanding what is the challenges that we see from a transportation agency, and understanding with the conversion of EVs and what does that mean for transportation funding as a whole. I'll say, I know Senator Hansen made a very good point about fuel indexing, and what that has been meant for Washoe County has been a tremendous success, and has allowed us to keep our good roads good and allow us to have funding to provide those capacity needs that we have for our region, and then also take a look at our complete street program. So without the indexing that we had in Washoe County, we'd be way behind on what our needs is and satisfying those needs. So as we continue to look at that, what we're seeing is people are still driving more. The vehicles miles traveled are continuing to increase, but the revenues we're collecting at the pump are roughly flat or plateauing. And so as we look into what is the future of transportation, I think that's a great challenge we need to look into from us as regionally and us from statewide.
Okay. Our next question Hold on, lost my list. Okay, will come from Senator Titus.
I'm glad to be found. Thank you, Madam Chair, for the question. Thank you, Senator Donate, because that was exactly where I was going to go with my question. The fuel tax indexing is critical to being able to pay for you're using it for your complete street programs and streets in general. On a statewide basis, we also are looking at we use fuel taxes to pave our streets. I'm wondering what you've said. You already answered part of my question by saying it looks like that's flat in Washoe County, apparently. That fuel tax, and what are we going to do in the future? And I think you've answered that. We don't know for sure, and we're looking at options. So that was my first question, which has been addressed. My second question would be, do you have figures on what it actually costs to put in bike lanes, what the additional cost has been? And we know there's no capture of income from bicycling per se. And don't get me wrong, I'm not against bicyclers. I have actually been, you could say, crazy enough or brave enough that I've been part of the Oprah ride where I literally rode my bicycle from South Lake Tahoe down Highway 50 all the way to the Utah border. And it was quite the experience, and there's no bike lanes, the majority of that. So if you want an adventure on the road in Nevada, ride that Oprah bicycle ride and know how wonderful it is to have a bike lane, actually, when a hay truck tries to run you off the road. So having said that, that bicycle didn't pay for any of those roads, although it also didn't wear out the road like the trucks do and the heavy weight on that road. So can you give me a thought on what the plan is and what the cost is for those extra bike lanes? Do you keep any idea on what that is?
Dale Keller, RTC Washoe, and Southern Nevada can also weigh in. I'll say this. Initially, for bike lanes, what we've been doing is striping a bike lane, what used to be the shoulder. So as we look into keeping our good roads good in what we call our pavement preservation program, we've been converting a shoulder and striping a bike lane. As we look for capacity needs, we're looking into, all right, is there a mode shift that we can look for to preserve some of the capacity in our roadways? So when we look at our core of downtown Reno or downtown Sparks, we have limited capacity to widen out roadways or do that. So if there's a way to take trips off the roads, and overall from a transportation agency, we're looking into movement of people and goods. So as we look at that broader picture, yes, the fuel tax has been the main source of that revenue. Now we look into funding these complete street programs or active transportation programs. We're having that from a regional and local level about where that funding source needs to be coming from, right? So how do we satisfy the needs from the vehicles? How do we satisfy the needs from the vulnerable road users, from bikes and pedestrians? So that's a thing that we continue to have challenge with. Luckily, on a federal level with the bipartisan infrastructure law, that's provided some opportunity for direct funding for those types of investments for complete streets. As you saw from our revenues that we receive from the state level for that complete street program is relatively low. So we are supplementing that. We don't have a direct cost. To directly answer your question, we do not have a direct cost on what it would take for a bike lane because there's so many different ways how to calculate the cost.
I appreciate that. And I guess the other part of that question was other sources of funding, which you did address perhaps, from a federal level, but it's something that this body is going to obviously have to pay attention to in future, and I'm sure all communities will. So thank you, Madam Chair, for the question.
Absolutely. We will now go to Senator Daley.
No, it's all good. I haven't started to take a bite yet. So thank you, and I think they touched on some of it. Sorry if I was out of the room, but and I hope we can count, I know he's not in the room now, I hope we can count on my colleague from Senate 14 when we try to do the gas tax index statewide, and also try to capture the vehicle miles traveled for people that aren't buying gas. But nevertheless, that's not my question. So I'm more familiar with the projects, and this is for Southern Nevada RTC as well, more familiar with the projects in Northern Nevada, and a lot of the projects you guys listed are retrofit projects. You mentioned Sun Valley Boulevard and all of the infrastructure issues. You have to really bring that one up. I think you guys, or somebody's doing Lemon Drive right now. I think that's you guys. Audi Boulevard, but they're all areas where luckily there was room right? And I think someone mentioned that you don't always have that space. You also mentioned developer impacts and various things. So how much interaction do you guys have? Do they have to consult with RTC or even DOT when they're doing the land use planning at the county, the city level? When the developer is going to go in and say, hey, you can't mandate him that he puts this stuff in. He only has to mitigate his impacts, and you get into the whole legal thing of you're doing a taking or stuff like that. But can you make them, do they consult you and say, leave us enough room so that when we do have the resources, we can put this in? When you did Sky Vista, I think instead, luckily you had the room there to put into 4 lanes. But that's not the case everywhere, unless that developer leaves that space for future planning. Is there that coordination going on? Southern Nevada, same thing as well. If you're putting in, the development and you don't leave room for the future impacts and upgrades just for capacity, but then also if you're going to put in the complete streets and you create a problem by eliminating capacity, and it's a catch-22 sometimes. So how much coordination is there with the local governments and the developers?
Graham Dollarhide, RTC Washoe, for the record. There is definitely coordination going on, both at the policy or program level and then at the individual project level. RTC does work with the local jurisdictions, City of Reno, City of Sparks, Washoe County, when the master plans are developed or zoning code changes or updates are made. So we have an opportunity to provide input at that point. Most of our jurisdictions do have policies already built in to address that issue of providing adequate space for various road users. And then at the project level, we also have an opportunity to comment during the development review process. So no, we can't dictate anything or demand anything, but we definitely have that coordination going on an ongoing basis and throughout the process. And a lot of times the needs that we have, they're both coordinated, but also a lot of times they do come through in the end result and give us that opportunity to massage the roadway as it grows, as the population grows, as the area is built up. So.
And I'm assuming similar answer from Southern RTC.
Yeah, Andrew Kelman, RTC of Southern Nevada, for the record. Yeah, we really try to integrate land use and transportation planning from the very beginning. And so similar to RTC Washoe, we develop a long-range regional transportation plan. And so that's where we forecast future growth in terms of jobs and people living here all the way out to the year 2050. And so we really try to help match up future land use with our transportation investments over the next 20 plus years. And then each of the local agencies maintains and adopts what's called their master plan of streets and highways. And that also builds off what their land use and zoning plans are for the future. And then at the project entitlement permit level, there's a lot of coordination going on between the permittee and the local land use authority. And then the RTC is also involved in that as well. Through our regional project coordination Seeing Orange map, we even include private developments on that because they do have roadway impacts as they're on construction. And then we are also coordinating in terms of transit amenities and siting new bus stops.
And thank you. And I'm just trying to make sure that we're doing what we can. And maybe there's, what have you seen from the development side? For instance, you're going to put in a big box store or whatever, and they do their traffic study and they say, hey, we're going to have, 2,000 average daily trips or whatever the number comes out to after they do their study. So you can't tell them, so, well, you got to finance the road for 10,000, daily trips. You just can't do that to them, even though everybody can see that with that development and then the next one and on down the road, those are going to be higher. But it may be some time before that next development goes in or the next subdivision goes in. I think it's just mainly leaving enough room for that to happen in concurrence with the development as it goes, because then the next 4,000 trips has got to be mitigated by the next development down the road. But if there's no space and you or you didn't, I know they see that with sewer line development and various things. They upgrade and increase that line based on future development. You're seeing some cooperations with the developers, north and south, and that's my last question, Chair.
Dale Keller, RTC Washoe. Senator Daly, yes. We're very fortunate in Washoe County. We have this regional road impact fee, as Mr. Nelson mentioned. And so we have this 10-year capital improvement plan that shows the need based off the Truckee Meadows Regional Planning Agency and land use that's been for consensus forecast. So we can predict what the traffic needs are. And that's allowed us, that mechanism has allowed us to set aside that right of way and taking per se, and allow us to have the opportunity to widen the roads, but also provide those other amenities as the locals wish to provide.
Okay, I believe that is all of the questions that committee members had for you. Thank both RTCs for being here today. We truly appreciate your presentation. And the committee is open to further suggestions. As I've tried to emphasize today, we want to know how we can be helpful in supporting the work that each of you are doing. So please let us know if anything arises. Thank you so much. With that, we'll go ahead and close out agenda item number 6. And we are going to take a 5-minute break for committee members who have not had a chance to grab their lunch to do so. I'm hoping that staff will join us and also eat a little bit of lunch. By 5, I mean a hard 5 minutes, not a traditional legislative 5 minutes. So it's 12:27. I'd like us to be back here at 1:33. So I gave an extra minute there. Okay, 1:33, the committee will be back in order. We're in recess.
Yeah. Are you giving us over an hour?
My apologies. I'm a lawyer. Math is not our strong suit. 12:33. 12:33. Hard 5. Thanks.
Okay, thanks.
All right, if everyone is ready, the committee will be back in order. And we will go ahead and open up our next agenda item. That's agenda item number 7, which is a presentation on Carson City's Complete Streets policy. We have representatives of the Carson City Public Works here today. Thank you so much for being here. Go ahead and state your names and begin when you're ready. Please do not mind us up here. We're going to do a working lunch here, but we appreciate you being here. Go ahead and start whenever is convenient for you. Thank you.
Thank you, Chair. I appreciate the opportunity to speak. My name is Chris Martinovich. I'm the Transportation Manager for Carson City Public Works, as well as the manager of the Carson Area Metropolitan Planning Organization. Darren?
My name is Darren Anderson. I'm a Senior Project Manager for Carson City Public Works.
You're going to want to turn on your mic.
There you go. My name is Darren Anderson. I'm a Senior Project Manager for Carson City Public Works.
So we're going to take you all through here a short summary of Carson City's Complete Street Policy and a few of our Complete Streets projects. Carson City's Complete Streets Policy really began in 2006 with the adoption of Carson City's master plan. It was made possible primarily as a result of the completion of the I-580 freeway, the Carson Freeway, the bypass that went from North Carson down to the intersection with US 395, US 50. It's southern end of Carson City. That allowed us to open up our other major corridors that were state highways at the time to other opportunities for complete streets enhancements. The Board of Supervisors, Carson City's Board of Supervisors, really is the body that set the vision for how we're going to transform Carson City and focusing on those major corridors, particularly of Carson Street outside this building, as well as William Street that leads out to Lyon County and points to the east. More formally, the Carson City Complete Streets Policy was adopted by the Carson City Regional Transportation Commission in 2014, with an update more recently in 2022 upon the passage of the previously mentioned Senate Bill 285 from the 2021 legislative session. The vision for Carson City's Complete Streets Policy is really to provide a connected city. As we've heard from a number of presenters prior to this, is that we're looking for an integrated transportation network that's safe and efficient, where all users can feel comfortable to travel the choice of mode of their choice to destination of their choice. We're really looking to provide an inclusion of that multimodal complete street concept, looking at design elements for all roads for all those different users, as we've heard today. Implementing that comprehensive program, identifying the practicality of treatment types and applying complete streets elements for Carson City based on the available funding, what type of project we're doing, and prioritization of different corridors. Then this applies not only to city-led projects, but it also applies to developer projects where they're coming in and building new streets or they're enhancing streets in an existing area of town. We look for complete street elements on all of our projects, with the ultimate vision to, we've heard, focus on transportation safety for vulnerable users and complementing other initiatives that are important to Carson City and its master plan, such as coordinating for a healthy lifestyle, recreational opportunities, sustainable and resilient infrastructure. All of that pairs well, Complete Streets pairs well with Carson City's master plan and vision going forward. To support Carson City's Complete Streets vision, we have a number of funding sources. Our primary funding source for this and our major corridors is our infrastructure sales tax. It's an 1/8 of a cent sales tax here in Carson City. And funding developed through that sales tax is applied to our corridor projects. So funding has been applied, as Darren mentioned, to Carson Street projects as well as William Street projects. And we look to continue that funding in the future. We're also supported by our local fuel taxes. In Carson City, I do know our fuel tax is 15.35 cents per gallon and 5 cents for diesel. I believe in Washoe County it's over 50 cents per gallon, I don't know the specific number, but I believe it's over 50 cents per gallon of gasoline. So a little bit of a comparison difference, and that could be why the price is somewhat different. We also do receive Complete Streets voluntary contribution, has been mentioned before. We receive around $10,000 to $12,000 per year through that $2 voluntary donation. That's around 15% of the vehicle fleet in Carson City based on 55,000 registered vehicles or so. So about 15% of the cars, registered vehicles, are donating those $2 for around $10,000 to $12,000 per year. We use that to leverage federal grants under the infrastructure law that was mentioned as well, where we have limited local matching dollars. And so any funding source that we can use to match larger discretionary or apportioned grants to Carson City is incredibly valuable to delivering any project, whether it's complete street or a standard roadway reconstruction maintenance project. It's critically important to our planning side, our project prioritization side, and our design side. And we've been really fortunate here in Carson City to receive a number of large discretionary grants from the Tiger program, and now it's currently called the RAISE program. We received, I believe it was $7.3 million through the Tiger program to reconstruct South Carson Street, and we more recently received $9.3 million for the reconstruction of William Street that Darren here will talk about in a moment. We do monitor our complete streets activities, primarily pedestrian and bicycle monitoring. We monitor them through two mechanisms. One is on our major corridors, but more broadly, we monitor and report our data through our annual network monitoring report. The Metropolitan Planning Organization, CAMPO in this case, provides and produces an annual report where we document and provide data on all sorts of different types of transportation metrics, whether it's vehicular, vehicle miles traveled, transit statistics, as well as bicycle and pedestrian statistics on our complete streets corridors. And so this is a snapshot of our data collection efforts over the last 5 years for these major corridors. Downtown, which is right out front of this building, was a complete streets corridor completed back in 2016. North Carson is a corridor yet to be completed, but we're still monitoring, collecting data. South Carson, the construction was completed in 21, and we're collecting data on that one. And then William Street is pending construction here in the next several months, and so we've been collecting data on that. Our data analysis and methodology of collection is maturing over time. We've more recently installed permanent counters that are going to more accurately provide us better data. We've heard a lot of discussion about data from the Office of Traffic Safety. When it comes to collecting data in Carson City, we've got some catching up to do, and we're working for ways to advance that and get more information out so that we can continue to justify why these types of projects and safety improvements are important to our area. So I'm going to turn it over to Darren. He's going to take us through a couple of projects and a little bit of a history of some of Carson City's projects.
Yeah, so for the record, Darren Anderson, project manager for Carson City Public Works. As Chris mentioned, we have a handful of corridor projects that came about through the relinquishment of some of these corridors from NDOT as they constructed around Carson City. So the first one was downtown Carson Street. And looking back through some old photos that I was digging up just to see the condition of the road or the size of it, the first one on the left is from 1940, and I was surprised to see that the amount of pavement and vehicles that were shown even at that stage or in that time. So fast forward to 2015 is that picture on the right showing, and it's obviously the time of day is a big factor here, but we did see significant decrease in vehicle traffic and vehicle counts from that point after the freeway had been routed around the city. So with the goal from the board and public was to make downtown Carson more of a central gathering place, a place that the community could come and have events. And so the concept was really based around making it more accessible and more inviting for all users, including the pedestrians, bicycles, the vehicles, those that use transit. So the picture on the left here shows the concept for the downtown Carson area. And that's indicating that the 2 lanes both ways was being reduced down to 1 lane, the addition of bike lanes both directions, and then the significantly wider sidewalks. Prior to the project, they were generally 6 feet wide, and then they increased from 12 feet up to 20 feet wide in some sections. The picture on the right there was just after completion, so just showing that in the end, wider sidewalks, vehicles were still able to travel, but many other accommodations were made. So the next one came in 2018, a few years later. This would be Curry Street, just a block west of Carson Street, and then the connecting cross streets between the two. So Curry Street was a 4-block, smaller project that came out to be around $4 million. Curry Street's a very tight corridor, but the same general theme and concepts were constructed for Curry Street, just as far as wider sidewalks, pedestrian improvements to the ramps, and reconstruction of the road. In Curry Street's situation, both the speed of vehicles is very low, and so the team didn't feel that the need to add bike lanes was necessary in this case. And just thinking from my own experience, bicycles often travel through here faster than vehicles at this stage, so it does seem to work well. The next project that came up was South Carson Street. So as the freeway was constructed in phases around town, South Carson was the next corridor that the vehicle traffic impact was alleviated from. So for South Carson Street, prior to our project, this was a 3-lane road, both directions for the most part, and then 2 lanes on the north end of South Carson Street. For the project that was constructed, that was reduced down to 2 lanes throughout the corridor, and that was due to the significant decrease in traffic volume through there. In this case, the corridor was very wide, and so rather than the challenge of trying to fit everything within the right-of-way, the width of the right-of-way, here was more how do we use this right-of-way most efficiently and also minimize the wide open feel of the road. So to do that, bike lanes were added, as well as construction of a multi-use path and then pedestrian improvements for as far as sidewalks. Next one coming up is the William Street connection. So this is coming in from the east end of town down to Carson Street. William Street's interesting because it has a little bit of a mix of both a very wide right-of-way limits as well as a very tight, constrained feeling. So on the west side, the right-of-way is very tight. There's not a lot of room to fit in other improvements. So we spent a lot of time looking at how can we reduce the lane widths for vehicles, squeeze in sidewalk, squeeze in bike lanes, make this all fit within the space we've got. Whereas further east, it's more of there's very wide lanes, wide shoulders, a lot of space to accommodate other uses. So in the end, there's a lot of just an infill of missing sidewalk, extension of multi-use path, minimizing of lane widths, all to come together. Also construction of transit stops to accommodate the complete streets goals. And then just a few others that are coming. So North Carson Street's the last of the main corridors that come into Carson Street or are part of the downtown core. So that one's planned to be kicking off in this next year, 2026. There's another project we've got, Curry Street, just south of the downtown Curry project, where right now it's just a vehicle traveled way. There's no accommodations for pedestrians or bicycles, so that will be added. US 50 East is just east of William Street, the project on the previous slide. That one, we're partnering with NDOT to see what can be done for that section of the corridor. And then we've always got other projects just in the Carson City area that we implement these practices on whenever we can. So that does it for our presentation. We're happy to answer any questions.
Committee members. Okay, we have a question from Senator Titus.
Thank you very much for the presentation. I do appreciate in all the many years that I've been coming to Carson City and my grandparents coming to Carson City, et cetera, the changes that have been made downtown. It's quite lovely, even though initially it was painful. You made a comment early on in the presentation because Carson Street it's 395. It's a state highway. It's an interstate highway, frankly. And now with the bypass, is it still considered a state highway, Carson Street, or did somehow the state doesn't have that anymore? How did that process, ownership or responsibility change?
Yeah, thank you for the question. Chris Martinovich, Transportation Manager, Carson City. Carson Street, as well as other streets like portion of East William Street by Mills Park, have been relinquished to Carson City by NDOT. So they're no longer state highways. Carson City has full ownership of those. Oftentimes, NDOT would support a local agency by doing a slurry seal or repaving prior to turning that over so that the burden on the maintenance is less so for those local agencies. But those are fully in Carson City's ownership and no longer part of the national highway, state highway system.
Okay, so it was under the purview of NDOT to relinquish that ownership? They didn't own them to begin. So I'm just wondering what that process was and where is it, and maybe our attorneys could help us. I was just curious, is it under the NDOT's power to give up a state road or state property?
Chris Martinovich, I can't specifically speak to the authority that NDOT has on that. I just know that through the various agreements that Carson City and NDOT executed over the years through the freeway construction project and the completion of that, the relinquishments were part of all those agreements in that process.
So at this point, you are responsible for maintaining the roads now on Carson Street, and you said they will do a slurry sometimes, but otherwise it's Carson that's responsible for maintaining the road?
Chris Martinovich, yes, that is correct. Carson City is responsible.
Okay, and then maybe legal can kind of let me follow up. It doesn't have to be now, obviously, but I'd be very curious to know what the process is when NDOT relinquishes ownership of a state highway. Thank you.
Yes, absolutely. I think, if I recall correctly, there are at least 2 items that legal might want to follow up on for us. The first being the question that Senator Nguyen had about automatic traffic enforcement and the existing cameras and why legislation might be needed. And then, of course, yes, if we could also ask that legal do some research on the process to turn over a state highway to a locality. Thank you. All right. Any other questions? Okay. Thank you both so much for being here. We appreciate it. Looks like you all are doing quite a bit of work and are on the back end of some of those big projects. So congratulations. We'll go ahead and close out agenda item number 7 and open up agenda item number 8, which is a presentation on extreme heat impacts and urban heat mitigation in Nevada. We have representatives of the Desert Research Institute, as well as representatives of the Southern Nevada Heat Resilience Lab. I believe all of our representatives for this item will be presenting virtually. Yes, and it looks like we have both of our presenters available. Go ahead and unmute yourself. Start your presentation when you're ready. Please don't forget to state your name. One of you's got to go first. So I don't, it doesn't.
I think that's me.
Okay, lovely. Thank you for being here.
All right, thank you so much. Dr. Tamara Wall with the Desert Research Institute. And let me share my screen. And I have a brand new computer, so I just realized that I may have some problems here. Ariel or John, could either of you share your screen and we'll just go along that way?
Yeah, give me just a second here.
Thank you.
Not a problem.
There's too many permissions I need to click on.
That's okay. Take your time. And if needed, we can always have broadcast and production services jump on and offer assistance as well.
Thank you.
Okay, I think. There we go. Let me share my screen here. I need to put it in presenter mode. Just one moment here. I'm sorry. Okay, we should be good. Is everybody seeing that?
We can see that here. Thank you so much.
All right, thank you, Ariel. So today we have, as I mentioned, for the record, I'm Dr. Tamara Wall, and then I'm joined by my colleagues, Ariel Chenard and Dr. John Mejia. Collectively, we have been working diligently the last few years to expand our research portfolio around extreme heat and wildfire smoke and the compound impacts of extreme heat and wildfire smoke, particularly in northern Nevada. Go ahead and advance, Ariel. So we just have a few basic statistics on extreme heat in Nevada. As you can see here, the trend lines for extreme heat and mean average temperatures at Reed International Airport are continuing to trend upwards. as noted by the recent extreme heat events in Southern Nevada, which looks like there'll be another one coming up soon. And then go ahead, Ariel. And then in Northern Nevada, you can see the same trend lines. As earlier presenters noted, Reno and Nevada are the fastest heating cities in the nation. And it presents some very unique challenges for everybody as we start to move forward into a hotter and hotter climate. And then go ahead and move forward. So I'm just going to present briefly on a very nascent project that we have just started working on, and then I will turn it over for more in-depth presentations to Ariel and Dr. Mejia as they are working on projects that are considerably farther along. So this is a project, the extreme heat and wildfire smoke in Nevada. One of the real challenges we have in Northern Nevada is that we often have the confluence of significant air quality degradation from wildfire smoke in combination with very warm temperatures, often into triple digits. So not as warm as Southern Nevada. It is still a very challenging period of time, particularly for residents that do not use HVAC systems. As you can see in Northern Nevada, we are about to really increase the number of heat wave days per year, up from 15 in 2000 to a projected 50 by 2050. You know, that is a very big jump. And then go ahead and shift forward. Thank you. So the real problem in Northern Nevada is that many people still do not have HVAC systems or air conditioning systems, or if they do have those systems, they are often reluctant to run them based on costs. And what happens at that point is these households really have to make trade-offs between, do I keep my environment, my indoor environment at a comfortable temperature, or do I open it up at night, often when wildfire smoke sinks lower into valleys and we get particularly damaging health impacts, to cool my house off. And so it's a real trade-off between indoor air quality and extreme heat. It's not uncommon. I think the highest that I've ever seen in Northern Nevada was, I have a screenshot on my phone of an air particulate, 2.25 particulate count that was 728 parts per million, which is just extraordinarily high. I mean, that is very damaging for anybody to breathe in, let alone pediatric populations, children, vulnerable populations, people with respiratory diseases and asthma. So what we are hoping to do, go ahead, Ariel, in advance, is what we really don't understand. We really don't understand hardly anything about how people make choices in this situation. So what are the trade-offs that they are making? Like, what is more important to them? Is it being able to sleep in a cooler temperature? Is it long-term pulmonary health, or concerns with air quality? We just do not understand what is most important to them. And so the current project, which is like the Southern Nevada Heat Resiliency Lab, is funded through the California Nevada Adaptation Project, which is funded by NOAA through the Climate Program Office and the Climate Adaptation Partnership Program Network, is we're going to try and understand with a very small selection of households in Washoe County that do not have HVAC systems, how they make these trade-offs. So it's a combined physical and social science project. We'll be doing in situ measurements, air quality measurements, and temperature measurements in people's houses, both inside and out. We'll also be taking some biophysical measurements of people, respiratory rates, heart, blood pressure, basic measurements. And we'll also be administering some surveys to try to understand the mental health impacts of making these trade-offs, and also the stress and the drain of functioning in an environment that is not only hot, but is also difficult to breathe and has its own set of health impacts. Our main partner in this is Northern Nevada Public Health, which we are very excited about. Again, this is just a beginning project. We're just recruiting households right now, and we're hoping to begin gathering data this summer. So with that, I will turn it over to my colleague, Ariel Chenard, who is the lead for the Southern Nevada Heat Resiliency Lab.
Hi, all. For the record, Ariel Chenard with the Southern Nevada Heat Resilience Lab. I'd like to tell you a bit about what the Southern Nevada Heat Resilience Lab is and what our work entails. As Tamara mentioned, the Heat Lab is part of CNAP, which is the California Nevada Adaptations Program, which is funded through NOAA in that CAPRISA program. We're housed in the climate change group here at DRI, and I am in Las Vegas, so I'm on the Las Vegas campus. We have a great team of folks and just actually hired a postdoc, Dr. David Almanza, to help support our work. So our work centers on the co-production of heat adaptation and resilience strategies with the people and the communities that are most impacted by heat. So by centering those frontline communities, we can better leverage local knowledge to develop and promote equitable and implementable heat adaptations approaches. And we're filling in a pretty large existing gap in Southern Nevada. So this project grew out of the fact that although there are many different types of practitioners and people and organizations and local governments that work on heat, nobody really owned heat. And so we provide that coordinating and collaborating space for all the different people who are involved in heat adaptation, mitigation, response, all sorts of things. And then we also help to elevate the voices of those who are most impacted. Why heat resilience? Heat is actually the deadliest natural hazard here in Southern Nevada, in the whole of the state, across the entire nation and the globe. The CDC reported approximately, I think it was 2,300 heat-related deaths in 2023. Here in Clark County, the health district reported 307 deaths. Some of the measures around heat morbidity and mortality are what we call lagging indicators, which means that they take time to collate, to record, and it depends very much on how heat illnesses and heat-related deaths are coded, either in a healthcare environment or by the coroner's office. So this is not necessarily data that we can get really good real-time look at the impacts of a heat wave. Our climate projections show that that currently we expect 20 to 18 days above 105, although 2023 had 25 days above 105. And then by 2055, we're going to be looking at 46 to 32 days over 105. What I do want to point out is that the trend grows warmer, of course, but that outlier events are still very possible in any particular year. And I think that's illustrated really well by the fact that we just broke a record for our highest temperature, which was 120 degrees. So everyone here in Southern Nevada is exposed to extreme heat, but the experience of extreme heat isn't equal. So it depends very much on who you are and where you live and what your circumstances are. So extreme heat can act as a chronic stressor for our communities, and it can also act as an acute shock depending on how long or how severe a heat event is. We often talk about heat and, so Tamara was talking about heat and wildfire smoke. We can talk about heat and drought or heat and COVID. So heat is very much a systemic issue here in Southern Nevada. And it can function to compound existing crises. We also want to talk about how folks are heat vulnerable and heat burdened. So heat vulnerable folks may have health conditions that impact how much heat can affect their physical health. And then there are heat burdened folks who are, maybe in our urban heat island neighborhoods who have challenges around, paying to keep their home cool enough during the summer. And I just really briefly want to make sure that we all know what the urban heat island is. And the urban heat island effect is a product of our built environment. So in those areas where we have a lot of impermeable surfaces like pavement, those impermeable surfaces actually absorb heat during the day and radiate them out at night. And overall, those spaces are hotter because of that built environment. Let's see, a few summers ago, in 2022, RTC worked with Kappa Strategies to do an urban heat island UHI effect mapping campaign. And we learned that our coolest neighborhoods, or our hottest neighborhoods, are 11 degrees warmer than our coolest neighborhoods. And although this mapping campaign took place on the third coldest August day ever recorded for Southern Nevada, that information about the difference in temperature between our warmest and our coolest neighborhoods is very revealing. And I'd like everybody to think about what that might mean on a day when it's 120 degrees. We also work a lot around community building. So last fall, we held community listening sessions. There were 2 sessions. The first one we held with community-based organizational leadership to hear about how the folks that they serve are impacted by heat, what their observations were. And that helped us scope a second community listening event with community members from our urban heat island neighborhoods. So this allowed really meaningful engagement with our heat burdened communities. In a lot of ways, these communities were not necessarily previously a meaningful part of heat planning or heat response. And it established a space for these communities and residents to articulate what they identify as their needs and their priorities for heat response, adaptation, and mitigation. There's excellent momentum for more community listening sessions, even outside the heat season. I usually like to talk to people about heat when it's actually hot out, but heat has such a huge impact on people's day-to-day lives that they're quite willing to talk about it even when it's cool out. And the feedback and the priorities identified by community helps the Heat Lab co-create and prioritize our heat-related actions. This is our project's second summer. Last summer, I put together a heat working group for all those different types of practitioners who work around heat. It started with 8 members, and this slide is ever so slightly out of date. At my most recent convening, we had about 75 members in that group. So that really illustrates the need for that collaborating and convening space. We hold calls during and after heat events to talk through response, to identify where we can share resources or information, and to help build a more robust response to heat here. And it also helps, too, to prioritize actions. One of the most interesting things we heard from our community listening sessions is that although this project grew out of a need to provide that collaborating and convening space because nobody owned heat in any official capacity, what we hear from community is that we all own heat. And that was very surprising to us. We also heard that folks face some really bleak trade-offs when it gets really hot. We know that people choose between putting food on the table or keeping their homes at a safe and livable temperature. We also heard, too, that unhoused folks are the most likely to seek resources like a cooling center, whereas housed people do not. And I think that's because in our UHI neighborhoods and some of the areas in town where the heat is most intense, we also have other types of inequalities at work too. So that could be income inequalities, health inequalities. And even if a home is not a safe and livable temperature, to get to a cooling center, we are kind of asking people to expose themselves to more extreme heat just to get to the place where they might be able to cool down. We have heard a need for hands-on help in neighborhoods. And that we need to be developing multilingual, culturally relevant heat health messaging. We've heard that it would be useful to have a task force to make recommendations and encourage change around heat response and adaptation. And we've also heard a lot about shade equity. So some of our UHI neighborhoods are also neighborhoods that don't have a lot of shade, which makes sense when you think about that built environment and how UHIs function. But that shade is needed, and not just tree canopy, but even built shade structures, particularly at bus stops, would be a wonderful intervention that community would like to see. So our next step is gathering clearer pictures of heat health impacts. And I also want to mention that although we think about heat very much as something that can make people sick or even kill them, There are other impacts as well. There are impacts to people's mental health because this is something that is chronically stressful to go through every single day. There's impacts on domestic violence rates, maternal and fetal health. So there's such a huge picture of how heat functions in our communities that we need to better understand. Dr. David Almanza, our new postdoc, is designing a cooling center usage pilot study for this summer. So cooling centers are activated when the National Weather Service issues an excessive heat warning, but they are our only response to an excessive heat warning. And we don't know how well this resource functions in our communities, who it's functioning for, when, and why. So we're going to work to get a better idea of how that resource functions during times of extreme heat. We also need to get a better understanding of heat health impacts and heat impacts in our tribal and our rural communities. Currently, we really don't know anything about that. We also want to get a better grasp on how hot our UHI neighborhoods are today and what that might look like in the future. And I mention that because, we did just have a day that was 120 degrees, which seems to be kind of a psychological barrier for a lot of folks when they see that number. It kind of has a little bit of shock value. It makes people stop and think, what does that mean that on 120 degree days, although some neighborhoods might not get that hot, they might only get up to 118 or 117. And we have neighborhoods that are 11 degrees hotter than that. That is significant. And in better understanding that, we can better communicate heat health impacts for those areas. And we can even work with the National Weather Service on changing thresholds for heat watches and heat warnings. We do need to get a better understanding of heat and air quality impacts here in Southern Nevada. I don't know that we deal with quite as much wildfire smoke as they do up there in Reno. But we do have issues around ozone and other types of particulate matter, and we need to know how that impacts people during extreme heat events. And we also need to do better with heat health communication. And you'll see two images here on this slide that are very representative of the types of images one might see in local and national stories around heat waves and extreme heat events. And I can't tell you how many times it's people like playing in fountains, which is fine, but that doesn't capture, how hugely folks are impacted by extreme heat events. So we need to do a better job with that. And I'll be handing it over to Dr. John Mejia just shortly, and he's working on one of our major questions, which is what can tree canopy do? And he's working on modeling different types of heat mitigation strategies so that we can better understand how and where to deploy increased urban tree canopy to benefit folks the most. And with that, I will hand it over to John.
Thanks, Ariel. Would you mind keeping rolling the slides for me, please?
No, yeah, happy to.
Thank you.
Is this your starting slide?
Yes, please.
Okay.
I'm having some issues with my camera. I hope that's okay.
That's perfectly fine.
Can you hear me fine? Okay, thank you. Good afternoon, Chair Harris, Chair Doñate, and committee members. For the record, my name is John Mejia, John Mejia, and I'm here. I'm an associate research professor at the DRI Division of Atmospheric Sciences. I'm a research faculty and representing my research group in atmospheric modeling. Similar models that we use to predict the weather, we can also use to estimate the impacts of climate adaptation plans. All cities around the United States are developing these climate adaptation plans, and now we want to have metrics or tools that help us assess a priori what could be some of those impacts, for example, to make cities more resilient to extreme heat. Next slide, please. At DRI, we are operating several of these models, and we are currently funded by the National Oceanic and Atmospheric Administration through the, different federal appropriation funding, task assignments, and competitive grants to develop assessments and tools that will help us assess the impact of heat adaptations and mitigation strategies. Next one, please. This is a time slice. Would you mind hitting play on the animation, please? These cities are growing, and one of the most extreme cases is that of Las Vegas, which didn't exist pretty much at the beginning of the 20th century, and now is a huge metropolitan area with a lot of heat issues. Time-lapse shows the built footprint, but also in red, it shows the vegetated footprint. Golf courses, turf grasses, parks. In these cities, and generally in urban areas in the arid and semi-arid climates of the Southwest, we face not only urban heat issues, but also water sustainability problems, very severe as well. Next one, please. Yeah, around the world, the urban infrastructure is adapting to the warmer environments, the urban heat island that we have heard throughout the day. Cities are using cooling strategies, some of which can be non-natural strategies, such as setting up rooftop solar panels, photovoltaic panels. These panels create an insulation layer that help in the sun reach the immediate roof and help cooling the inner rooms, and also why not alleviate a little bit of the electricity bill. Other strategies are, you may have seen a lot of big buildings around Las Vegas, and it's not exclusive for Las Vegas, but for many other cities around the world. Big surfaces, warehouses are painted with white coating in the rooftops and the walls. And it means that these surfaces reflect solar radiation and limit the heating throughout the day. And they don't get as warm as otherwise would be with darker surfaces. You will see a lot of cities and infrastructure getting wider because this is one of the options we have to cool down the cities. Next one, please. There are other more natural options. Some of these pictures are around my neighborhood where you can plant trees. Trees create shade. And also the underneath the canopy the comfort is much better. They also impact, create evapotranspiration, and that evapotranspiration helps cool down the environment to some extent. And cities around the world are thinking about building urban forestry because it helps create more shades. And some of the projects some of the presenters presented earlier, they had these trees emphasized in some of their projects. Also, outdoor water, irrigation, and water ponds also help keep the city relatively cooler. Green roofs is also quite typical in Europe, and now you can see many of those where they are planting vegetation in the rooftops. Some of them require irrigation as well, but some of them are pretty natural, and all these strategies help cool the city. Next one, please. We are scientists and using models and supercomputers, and we use them to, in this case, to develop urban canopy models to assess the impact of climate adaptation plans. These plans are, many of them are using, hey, we are projecting a city that is growing, and we're also projecting that we need to mitigate the heating associated with that. Many of the rhetoric around those urban climate adaptation plans, they use the term heat and cooling strategies like urban forestry and similar. So we as scientists can contribute to understand and simulate the impact of cool roofs and outdoor irrigation scenarios, for example. What are the trade-offs of enhanced water usage outdoors versus the white roofing? Assess the capacity to include the impact of urban trees, and even how do these cooling approaches respond during realistic heat waves? It turns out that the models understands or simulates the mechanics of, for example, when there is a heat wave, we tend to crank up the air conditioning. But part of when you cool down your indoor, the exhaust of those air conditionings heat up the outdoors, making the heat wave more complicated, impact even worse. And everybody does that. So during heat waves, our cooling needs also exacerbate the heating outside the city in the outdoors and exacerbates the impact of heat waves. So these feedback mechanisms we try to incorporate within our models. They are very mechanistic, and we use them to really simulate not only the impact of the built environment, but also the impact of our behavior around excessive heat. Next one, please. This is two cool, pun intended, examples showing on the left-hand side the impact of exaggerating the irrigation, outdoor irrigation in Nevada compared to no irrigating the Las Vegas, sorry, and showing significant cooling. Those cooler colors are showing that in the order of 0.5 degrees Celsius, you can cool down by enhancing the irrigation in the outdoors of Las Vegas. In the right-hand side, you see the impact of painting with white coating all the rooftops and roads in Las Vegas. You can see that you can get a similar cooling by adopting this strategy. But these are really extreme scenarios of how much potential cooling you can get out of these alternatives. And they are similar in effect. So maybe a combination of them could be the answer if practical. But next one, please. This is another example. This is the city of Las Vegas. This blue bulb is the cooling we can get after planting around between buildings. We call that the right-of-way along the streets. At least 50% of that area covered with trees. So it's a very extreme scenario highlighting that the model depicts or predicts a cooler city. Sometimes to the extent that we can mitigate the urban heat island effect. How that behaves during heat waves, we're still assessing. The problem is that these scenarios are kind of unrealistic, mainly for a city like Las Vegas, where sitting in a very arid, semi-arid geography with a lot of issues in urban water sustainability. Next one, please. For that reason, we are creating more realistic scenarios. For example, in this case, we are collaborating with Southern Nevada Water Authority, and they are providing us with beautiful data sets about the tree inventories for the city of Las Vegas, the metropolitan areas. And we are using that information to assimilating that data into our model to make it more realistic. So the little green colors in the left-hand side highlights the tree coverage, showing that at most we have some places with 0.3 or 30% of coverage along the streets. Very low compared to the scenario we were putting on before. But we know now where the trees are planted in reality. The right-hand side shows a map that several of our presenters have shown today. This is the extreme heat vulnerability map for the city of Las Vegas, provided by the Regional Transportation Commissions of Southern Nevada. And some of the ideas is where to plant trees. Practitioners care about whether or not we want to impact the more vulnerable communities, or whether or not we want to impact the hotspots in terms of urban heat islands. So this debate about where to plant the trees with the limited resources available it comes to problematic, but the model can help us inform and provide the information to practitioners. So one option is to target tree planting projects over extreme heat vulnerability areas. Okay, next one, please. So some remarks, because this is just an overview of the capacities and the infrastructure capacity we have to ask these questions, is that urban modeling can support urban planning and decision makers for our specific geography and even urban fabric. Many cooling adaptation strategies are available, but what's best for our geography? What's best for our cities? What's best for the resources that are available? So assessing the best option for this climate is a challenging problem. It's our research problem. And we are collaborating with practitioners because we want to develop the science, but we also want to make that information usable for them to become more efficient at the time of implementing these cooling mitigation strategies. And we can assess the potential of those projects and even some policies. Next one, please. So to finish, we have some research needs where we are not finished yet. We are still long ways to keep understanding. For example, we need to improve the models by adding better information to our urban models. The city of Las Vegas is a city that has all these problems and is becoming more like a test bed for us in developing the science around it. Now we are going to include Reno Sparks as unincorporated areas to perform similar modeling work, especially now that the NOAA Heat Map campaign will take place next week on Saturday, July 27th, if things go right. So we are thinking along this excessive heat problem, and through the federal resources, we are even enhancing the observations often necessary to engage in the discussion. Understanding why Reno is one of the fastest warming cities in the US is one very important question and a very scientific, relevant, challenging problem. And the problem associated with heat is that it's also related to how we grow the city, the materials we use. It impacts air pollution. It impacts the energy transition components and the human comfort. So we are here to help in understanding what that nexus are, even including the urban ecology, the urban fauna. So next one, please. So with this, we finish our presentation. Thank you very much for your attention and having us here today. Thank you very much.
All right, thank you. We have a question from Senator Titus.
Thank you, Madam Chair. I actually have several questions, and thank you for the presentation and the comparison and the research that you are doing. I have some questions specifically about the comments regarding the rooftops. And it has seemed to me that you mentioned that using the rooftops as white on top of these buildings, and that's been kind of a common sense thing to do for a long time in these big buildings and hot areas, that you would make them white to reflection, and white cars don't heat up like the black cars do. Some of that is, again, common sense. What I've been concerned about, though, that we have brought the solar industry into this, and now we're putting these solar panels on top of these roofs, and we truly are making, in my mind, things hotter by putting these black panels on all these roofs and not having that white reflection. Do you have any data at all on the amount of space, square footage, that we have now black objects that are sucking in the, yes, solar rays, but at the same time heat, versus what a white roof would do?
John Mejia, DRI for the record. Thank you for your questions, Madam Senator Titus. I believe this is a very important question. However, I don't have in my mind or in my records the amount of photovoltaic panels and the area they are covering at the moment. It is known that they do produce a net cooling effect regardless of the reflectivity of the surfaces by isolating the house underneath. So it's easier to cool down the house inside, yet you produce less air conditioning exhaust, and with the benefit of having the extra electricity from solar power. But the net effect is of cooling, despite the color of the surface. Some of the solar radiation doesn't transform to heat, but electricity. So that's kind of one of the ideas, that the black surface is not necessarily converting to heat, all of it.
Right.
So, but I don't have at the top of my mind the information about the aerial coverage that is currently out there. Thank you.
All right, great. And a follow-up question, if I might, Madam Chair. So one of my theories also about the increasing heat in places like Reno, which used to be the Truckee Meadows, and there was water and creeks and lots of meadows in Washoe Valley. And as urban expansion has happened, and we now have more rooftops and especially more blacktops, I'm wondering if there's any data on the increased temperature of an urban area based on how large it has grown. In other words, have you extrapolated, okay, we grew this much now, this much more blacktop versus when it was a pasture land, and if that is playing actually to the actual increase in Washoe County and even Las Vegas for that matter?
Tamara, Ariel? No?
Yeah, Ariel Chenard with the Southern Nevada Heat Lab for the record. I think I can start to answer that question. So we know that there's a difference between our built environment and what you might call the natural environment. So even down here in Las Vegas, the city is hotter than the surrounding desert because of, our impermeable surfaces and that urban heat island effect. So yes, as cities expand or grow into new areas, it can raise the temperature of that area depending on how that development takes place.
Along the same note, one of the presentations on resolutions and solutions for this, I didn't hear, and in previous meetings that I've been in, one of the solutions is there's a special chemical treatment that you can do to blacktop surfaces that they're using in areas in Arizona that actually it's white, it's lighter, and that's proven to reduce the heat there. Has that been in any of your data or any research for Nevada?
Ariel Chenard, the Heat Lab for the record. So there has been further research done on those cool pavements in use down in Arizona, particularly in Phoenix. And what they're finding is that cool pavement isn't a great fit for areas that have a lot of pedestrian traffic. So what happens during the day is you have hot temperatures and a lot of sunlight coming down. And if you're there at the pedestrian level, that sunlight is actually getting reflected back onto you. So it actually increases people's discomfort. So with that in mind, cool pavements aren't a mitigation or an implementation that is going to be appropriate for every spot, for every urban heat island neighborhood. So where it could be implemented, I know that RTC has looked into that. I think John's study might take into account cool pavements as well. But that's my understanding right now of where it stands with cool pavements.
Final question, I promise, Madam Chair. The other thing is, part of this body years ago passed a bill that mandated in Southern Nevada that no one plant, there was no grass that if people don't actually use the grass and it was just mowed, that grass had to be removed. Subsequently, now we're hearing that, oh gosh, temperature's increasing, we need to plant trees. Artificial turf may not be safe, depending on what's made out of, et cetera. Has any of this data, you talk about trees, but thoughts on replacing, rethinking the mandate to remove grass?
Ariel Chenard with the Southern Nevada Heat Resilience Lab, for the record. So, the removal of non-functional turf, and that definition is the only person who walks on that grass is the person who mows it, is necessary because grass uses just an incredible amount of water here in Southern Nevada. It's not obviously a native plant. And so by removing that, we hope to, save that water. And replacing with trees, if we're replacing that non-functional turf with native and adapted species of plants, we can keep that cooling benefit that the grass kind of provided through evapotranspiration, but through shade this time. And it uses far less water, and it's still, of course, can be very beautifully done, and benefits communities in other ways as well. But we do recognize that it's going to take water to grow trees and maintain trees and grow them to a size at which they provide the shade benefit that we are looking for. However, that amount of water is far less than if
Well, thank you all for that. For the responses to those questions, and thank you, Madam Chair, for that. I always worry that we as humans try to manipulate things that we shouldn't be doing, and then we're making it worse, trying to make it better. So thank you for at least bringing some research to the problem. Thank you.
All right, and I believe, Ms. Wall, you had your hand raised at a certain point. Was there anything you wanted to add to this discussion?
Tamara Wall, DRI, for the record. Just briefly, I think to Senator Titus's point is that the concept we're really trying to work on here is shade equity. And what that looks like can be a combination of both a natural environment and the built environment. And happily, we receive funding from the USDA Climate Hub, Southwest Climate Hub, to hire a position to look at that and work with our UHI neighborhoods on what shade equity looks like to them through both planting trees and other forms of the built environment.
Okay, Assemblyman Ornlicker.
Thank you, Chair. Thank you for this very helpful presentation. And it's nice to know you're identifying ways to reduce the urban heat deck with cool pavements, cool roofs. And so I'm wondering what that means for us coming back in the legislature. So the people who are doing the cool roofs, are they doing it because these are developers or building owners who are trying to reduce their air conditioning bills, and they're doing it out of their own self-interest or their federal incentives? And that leads me to wonder whether we should be thinking about mandates at the legislature, saying, here's the kinds of things you can do for your roof to cool, and here are the roofing materials you shouldn't be using, and we won't let you use. Is that something that we should be, in terms of what we make of this knowledge for our work?
John Mejia, DRI, for the record. I will dare to address a part of that question. And I know that white roofs are one of the solutions. There are trade-offs with regard to comfort and some of them regarding to air quality. But my understanding is that some cities are passing legislation to rebuild the building code, asking for at least certain reflectivity from those rooftops. Even though our role is just to assess the impact of those rules, we are always digging to see what are the requirements, what are the scenarios we need to perform and simulate. And by digging through that, we have seen several cities, one of which is Houston, Texas, for example, now changing the building code, asking for new communities to deal with high reflectivity surfaces.
Does that answer your question, Assemblyman?
Yeah, thanks.
Okay, great. With that, we'll go ahead and close out agenda item number 10, 9, 8. Just kidding, agenda item number 8. And move on to agenda item number 9. That is a presentation on the Healthy Homes program. We have representatives of the University of Nevada, Las Vegas School of Public Health to present virtually. Thank you so much to our DRI folks. I appreciate your presentation and the thorough research that you've provided. The committee will be in contact with further updates and suggestions. And we now, again, will have the University of Nevada, Las Vegas School of Public Health talking about the Healthy Homes program. We've got Dr. Sean Gertzenberger. Hopefully I said that correct.
Yes, thank you very much. For the record, Sean Gerstenberger. I am the Dean of the UNLV School of Public Health. Audio and video are okay there?
Looking good.
Awesome, thank you. So what I would like to do today is just give you a very brief, kind of a high-level presentation about the home as a critical determinant of health, specifically as it relates to a Healthy Homes initiative. And so when we talk about a healthy home, what does that mean? And so specifically, that means that your home is designed, constructed, maintained, and rehabilitated in a way that is conducive to good health of the occupant. So it's kind of a perfect segue from our last discussion about the home and how the home impacts the environment. It also impacts your health. This is not anything new. Almost 20 years ago, 18 years ago or so, 3 major federal agencies got together and created this Healthy Homes initiative. That was the Centers for Disease Control and Prevention, which really looks at health and health outcomes. The Environmental Protection Agency, of course, who looks at the environment, and HUD, the Housing and Urban Development. And they realized that these 3 things interact. It's that first law of ecology, right? You can never only do one thing. So how do we design, construct, maintain, and rehab homes in a way that's conducive to health? And what are the health problems related to poor quality or poorly maintained or constructed housing? Well, we know that housing impacts our health in many, many, many ways. It can be a physical impact. Have you heard about heat and heat impacts? There can be chemical impacts from things that are brought into the home unintentionally, like asbestos and lead. Or it could be things that you spray in the home, like pesticides or other biological exposures and things like mold. We know the house, heat, overcrowding, conditions in the home, all can have psychological effects on those families and have mental health issues as well. If you think about your home, it's designed to be an anti-environment chamber, right? If it is hot outside, you want it cool. If it's raining, you want it dry. If the humidity is high, you want the humidity to be low. And so your house is really designed to put you in that little perfect zone of, 70 some degrees, low relative humidity with appropriate airflow, where we're all happy and safe. And so, but when that house is not functioning properly, those things can go wrong. So why do we care about the home environment and how it impacts health? We know that young children spend a lot of time in the home or in an indoor environment. It could be at school, in their home, or in other places, up to 70% of their time. So we know that is going to impact their health. This is nothing new. An old quote from Florence Nightingale, highlighted that we know there's a critical connection between the health of the humans and the health of the dwelling. For those of you who are history buffs and want to know, she was born in 1820, died in 1910 at the age of 90, and was already talking about healthy homes, just in a little bit of a different capacity. We have several very vulnerable populations to adverse effects in the home. We've talked a little bit about children. They spend a lot of their time indoors. We know that they eat and drink more proportionately than adults. So if I drink a 6-ounce glass of water and a child does, that's not an equal dose. So when we say they drink more, it's not necessarily by volume, but it's proportionately. We often tend to think about children as little tiny adults, and that is just not the case. They behave very differently. They're still growing. They have rapidly dividing cells. They're susceptible to the impacts of things from the environment, chemicals. Just as one example, think about your breathing zone, right? When you're standing up or sitting in your chair, the air you're breathing is up here. But a small child that's 1-year-old is going to be down on the floor. Their breathing zone is where the dust, the dirt, the contaminants, the pesticides, and other things are. And they're going to have a very different route of exposure, even though they may be in that same environment. We also know seniors are highly susceptible. They also spend quite a bit of time indoors. We know we have a lot of issues related to breathing problems and COPD. Falls are much more common. The state of Nevada, we average almost 270 deaths a year from falls in the home for people over the age of 65, which is for the most part preventable if we do home interventions. And we're also worried about overheating, obviously, especially in these very warm environments and climates, just like the last presentation you heard. If your air conditioner is not functioning, you can have issues. So one of the things that we do as part of this National Healthy Homes Training Center that we're a part of here at UNLV is we try to get people to think about their house as a system, and that it's a system that interacts with some of these critical components in our environment, right? You may be wondering, why does he have birthday on there, right? But if you think of the house as a living system, it has a day that it's born. That's its birthday. It's recorded. And we have a day that it's torn down and it dies. We have air that comes in and air that goes out. It breathes. Equal amounts of air go in and out of a home. If you bring in clean air, that's a good thing. If you bring in bad air that contains radon or other contaminants or smoke or dust, like you talked about in the last presentation, that can impact health. Water coming in the home, right? We have lots of issues related to things like mold and asthma triggers, water leaks, also water coming in from floods or other natural events. How it interacts with the soil, that can be dust that is blown in, those can be the soil that the foundation is built on, it could be how the septic system operates. And then last but not least is fire, thinking about how we heat and cool or cook in that home. And if things burn and have a flame, they usually produce gases, carbon monoxide, carbon dioxide, that need to be vented outside. So when you start thinking about this house as a system that not only creates a healthy and happy environment for you, then we start to impact health in some meaningful ways. So there are 7 main principles. This is about a 4-day course that we go through, and I have about 5 minutes, so I'm not going to run through all these and all the principles for each one. But there's 7 things that we teach people to do in their homes, and we implement these through all different agencies, with all different partners, through all different research projects. And these are the 7 things, keep your house dry, free from leaks, free from water damage, free from foundation cracks, and things like that. Because if water gets in the home, it will tend to deteriorate your paint. It will create avenues where pests can come in, and it leads to other problems. I always joke, as a general rule, I've never seen a water leak get better, right? They always go from bad to worse unless they're addressed. Keeping your house clean, free of pests, free of dust, free of other things. Keep the house pest-free. Appropriate airflow and ventilation that can move bad air, contaminated air, or air with combustion gases out and bring in fresh air to those residents. And we know the impact of air in a home. If you're sitting there and it's very still and you turn on your fans and you get air movement, the environment just seems healthier and safer because it is. Keeping things safe from trip and falls, securing different things in the home that create trip and fall hazards. It can be grab bars in bathrooms, not spraying pesticides, and then maintaining things when they go by. These are the 7 principles that we have entire lectures on that we've trained people throughout the state of Nevada on these 7 principles. So I want to just highlight a few of these and how they impact Nevada, and then at the end I'll talk about some of the ongoing projects we have that are continue to address these. So you may not always think about hazards in the home that are related to asthma or asthma triggers. But you know that there are house dust mites. If you have dust, you probably have house dust mites. You may have that image in your brain tonight when you go to sleep. But there are also dander from cats, dogs, cockroaches, mice, tobacco smoke, and mold, all that can trigger asthma in children. There are many, many children that end up in ERs for asthma attacks. These result in days of missed work for their family that have to stay home, that can result in resource allocation issues. And if they continue to hit the ER over and over, they don't get necessarily, the hospitals don't get reimbursed because they come back for the same problem that the ER was supposed to address. We've started some innovative programs working with ERs, identifying children that have multiple asthma triggers over the course of a year, doing a home investigation, and then giving them an intervention to reduce the asthma triggers at the source of the problem. And it could be something to clean your house. It could be a kennel for your dog to sleep in at night so it doesn't create an asthma trigger, but there's some very creative ways to increase the health of the occupants. We know that if we have moisture in our indoor environment, they're associated with nose and throat irritation, coughing, wheezing, asthma, pneumonia, COPD, and other preventable diseases if that house was kept dry and it was helped to be maintained. There's an overwhelming amount of literature that demonstrates damp environments in the home are not conducive to good health. Okay, some of the big ones that we've spent a lot of time on over the last few years have been lead and lead-based paint. So homes built prior to 1978, which is roughly 24%, 25% of the housing stock in Nevada, may contain lead-based paint. We have very low testing rates for lead-based paint, and we have very low testing rates in children to evaluate their elevated blood lead levels, which is part of required screening for Medicare and Medicaid. We know lead can cause permanent reductions to IQ scores that are non-reversible if not caught and removed from that source early. Okay, and then radon we know is a naturally occurring gas. We have about 9 counties in Nevada that exceed a lot of the EPA standards for radon. Quite a few of those are in the north. And how we can mitigate radon gases from the home. If left untreated, those can accumulate in the home and related to lung cancer and for outcomes related to health. I know it's hot and we're not thinking about heat today other than how hot it is outside. But it does get very cold, especially in the north, and folks tend to heat their house in unique ways, especially when their air conditioner / heater is not working properly. They may heat with furnaces, they may heat with candles, they may open their ovens or stoves to get heat in the house, which can produce carbon monoxide or carbon dioxide. We see 10 to 15 deaths every single year in the state of Nevada for carbon monoxide poisoning for people trying to heat their homes in alternative ways. And just one of the last ones I want to talk about are some of the preventable hazards in the home, things like falls, poisoning, fires, burns. We work closely with some of our nonprofits down here, Rebuilding Together of Southern Nevada. We have initiatives where we go into the home and do renovation and remodeling for critical repairs. We can do health assessments, and we can do comfort height toilets, grab bars in hallways. We can remove unsecure flooring or unstable flooring to prevent falls from happening. Falls are very expensive, and we know that about 80% of people that fall in the home over the age of 65 will fall again within a year. They go to the hospital, they go to rehab, they go home into the exact same environment where they fall, and they fall again. And we're trying to get in that loop to stop that recurring fall in the exact same environment because we just didn't fix it. So wouldn't be a professor if you didn't have a bunch of quotes from a lot of famous people. So I've fulfilled that requirement here. You'll just see a bunch of quotes related to the home and the home environment. But it's a tricky situation to go in and talk to people about. There's things in their home that are not conducive to health. If it's dirty, if it's cluttered, if they're a hoarder, if there's water leaks or sewage problems. And so we have to get creative with the way we communicate through all the different agencies and partners to improve the quality of life within these homes. So at the end of this, we want to know, like, who can help? What do? We are a National Healthy Homes Training Center. We've taught thousands of people across the state of Nevada these 7 Keep It principles. Everything from healthcare, code enforcement, nonprofits, hospitals have taken these courses. and they can do this work in the community as part of one of our many efforts. If you think about your home specifically, how many of you had a water leak, someone trip and fall, a broken heater or air conditioner, you've sprayed pesticides or had a bug in your house in the last year, right? If the answer to any of those is yes, there are one of those 7 keep-its that could be applied to that situation to improve it. So we have ongoing projects. We do programs like safe sleep programs in the hospitals. Don't put things in the cribs, remove strangulation hazards. We do that with Sunrise and UMC. We run a landlord-tenant hotline. So tenants can call in and try to address health issues where the landlord is not addressing things in the home. Could be bed bugs or cockroaches or other things. And we try to get them through legal counsel or the health district to improve that. Similarly, we can have landlords help kick people out who are causing those problems. So it works both ways. We've run the childhood lead poisoning prevention program for the last 15 or so years in collaboration with the health district and a wonderful partnership with the Nevada State Health Division. Our screening rates still remain very low. We're not testing houses, we're testing kids, right? That is completely backwards. We shouldn't be using kids as bioindicators to find the lead-based paint in the home. We need to be testing the homes and reducing the amount that's in the kids. We've had funding for years on that. We've got several asthma projects, which I discussed, the trip and fall projects. And then we're also an EPA training center here. So we train all the lead risk assessors that go into homes when children have elevated blood lead levels about 3.5 micrograms per deciliter or higher. So what can you do to help as legislators? I think the recurring problem we have is funding. We have to write grants, they run on 3-year cycles, and we have a great start, and then we run out of money at the end of it. I would love to see if there are some creative ways, like other states have done, to institute a way to collect fees. California, for example, has a fee that they do for any pre-78 home that's renovated or remodeled. And then that goes back to support healthy homes and lead programs, so they have a sustainable source of money for the state. It's a relatively small fee, but it generates quite a bit of money because there's a lot of homes. I think that would be a unique thing to do. I think we could get creative with things like Medicare and Medicaid reimbursement. There are states that will reimburse people to replace windows in their homes, remove lead-based paint, or remove asthma triggers that are part of their permanent structures, and it can be reimbursable on Medicare and Medicaid to get upstream and prevent these people from using the same health resources over and over. And then last but not least, we've tried in the past to talk about a grading system for rental properties, much like we do when you go into a restaurant and you see they have an A, B, C, D grade. We would have them go and evaluate those homes on the healthy homes principles. Are they doing all the keep-its? And they would get an A, B, C, D rating, and they could use that as a revenue stream to make sure the housing is safe, the landlords are responsible, and then when they advertise, they could advertise that this is a healthy home. So those are just some creative solutions, I think, that perhaps you as legislators could entertain. I will stop there. That is the end of my presentation, and I'll be happy to take any questions.
Thank you so much, Dean Gerstenberger. Chair Harris did have to catch a flight, so I am going to chair the rest of this meeting. Committee members, do we have any questions at this time? I have a few, so maybe I'll start. Dean Gerstenberger, you were mentioning that some of the programs that you have through the Healthy Homes program and initiative in the School of Public Health, a lot of it is, based on my understanding, federal grants. So how much do you receive in terms of federal grants for this program? And I would assume that you receive zero funds from state dollars, correct? So it's a two-parted question.
Yeah, so there's, I'll try to go quick on that. So there's 3 or 4 pots of money that CDC has. They do the childhood lead poisoning prevention program. We do receive those funds. I think that's about $1 million for, I think those are 4-year grants, 3 to 4-year grants. I don't remember the term. We have several technical studies grants that are wrapping up from HUD. Those were around $700,000. And then we've had 2 projects, one in the city of Henderson, and then we had another one we launched with the city of Las Vegas to remove lead-based paint and do healthy homes. Those were around $1 million a piece. And then we've had some other smaller asthma projects for around 50. But We do have a few funds right now through ARPA dollars to expand testing for kids throughout the state. So there's a portable device called a Lead Care 2. You do a little finger prick, you can do a blood test. We've trained people at Central Nevada Health District, Northern Nevada Health District, and across the state, and we've got them those devices so that we can test more children for lead across the state. So I could go on, but I'll stop there. That's probably more than you wanted, right?
No, and so in terms of the City of Las Vegas program, so you were going into homes to help renovate them if they had lead-based paint. It was specifically just for lead. It wasn't for instance, asbestos or any other products in the home, or?
Yeah, since it's under HUD, it was a lead-based paint program. So in Henderson, we did complete the project. We had 100 homes with lead-based paint, but then we did all those other things that I mentioned when we were in there. Trip and fall hazards, electrical hazards, fixed roofs, sealed for pests. And we did complete that. That started again with the City of Las Vegas during COVID, and it had a few kind of bumps in the road and some false starts, but that program is still ongoing at the City of Las Vegas.
Okay, and do you expect that funding to run out at some point? Is it grant-based, or was the program renewed?
Yes, those are all grant-based. So those are usually 3-year grants, and so within a year or two, most of our funding is running out on those within the next year or less. The lead one, we just got renewed, so we've got several years on that. And the health districts have been great partners, but I think without a revenue stream to have people that work in lead and healthy homes and create an office of that, it's hard for them to justify those positions. And we don't test a lot of kids, so we don't have a lot of lead poisoning cases. So, it's kind of a strange cycle that you're in there.
And then in terms of Medicaid reimbursement, have you seen states introduce a state plan-based amendment, or is it already reimbursable through CMS? I guess what have you seen in terms, how do we tie that?
Yeah, the only thing through CMS, through the early prevention, screening, and diagnostic testing is the test for lead in children under the age of 6. That is already reimbursable. You would have to do a state-based amendment to do things like go into a home and replace a window or remove lead-based paint or address an asthma trigger. New Hampshire, a couple other states have done that through state-based initiatives they're pretty unique and they're pretty innovative, but I think those are some really creative ways to look at solving some of the health problems.
Yeah, if you could send us a language on that, I think that would be something that we would definitely entertain. Senator Titus has a question.
So thank you for that presentation, and thank you, Mr. Chair, for the question. I was curious, you mentioned things happening in Clark County, things happening in Washoe County. I didn't really hear you say anything that you have offered, if anything, in the rural counties, or maybe our tribal partners, anything there?
Yeah, that's a great question. We certainly have worked with the rural counties as well. A lot of those, as you know, go through one of the health districts. Back when the program started, those other health districts didn't exist. Some of those are still new. So there was kind of the north and the south. Now we have, the central and the other health districts on board. We have trained personnel through our EPA training programs to be lead risk assessors. They can go in and address elevated blood lead levels in the home and do what we call an environmental investigation, where we find the source of the lead in the home and remove it. So we've done, I think about 9 or so folks have been trained across the state to address those rural areas. And we have offered those trainings. I've done trainings in Ely. I've done them in Reno. We've done them down here. And then we've done a few online trainings as well to try and address those rural areas. And we've done a little bit with the tribal communities, but there are a few different rules and regulations there that complicate that sometimes.
Thank you for that. I live in a home that was built in 1912, and I trap mice and squirrels daily. And so it's not something that we're going to eliminate in my rural community, I will tell you that. Just to be clear, as a physician, I understand that lead, just for people to know, the lead doesn't jump off and get into your system. You really have to ingest it or somehow, eat the lead paint and all those. I don't want anybody out there that, in my rural communities that live in these homes that were built a long time ago to think that it's an issue. We certainly don't want lead paint, but at the same time, it also has to have an access to you.
Yes, thank you. I mean, again, Sean Gerstenberger for the record. And we've tried to be preventative with that. We completed a project a few years ago where we addressed every licensed daycare facility in Clark County. We did a full lead inspection. We tested water, and we made sure that there was no lead in those facilities, no lead in that drinking water. And this was long before Flint, Michigan happened. We were doing all this from a preventative strategy. So those older homes, especially when they deteriorate and get wet, is when we see the paint deteriorate, and we get a lot of exposures from lead-based paint in older homes.
Great. Thank you for that clarification. Thank you, Mr. Chair.
Thank you so much. Any other questions? Dean Gerstenberger, I just wanted to thank you for some of the state proposals that you mentioned. I had the chance to review it before this meeting, and I saw that some states, it's quite a wide range of policy initiatives. Some states do tax abatements for seniors and low-income households that might not be able to afford the conversions of their homes, or to at least renovate them with some of the substances that you mentioned as part of your presentation. I know there's certain cities that do low-cost loan repayment or loan programs / grant programs to help renovate homes. And so I think these are definitely the conversations that we definitely need to have ahead of next session, but I will take you up on the Medicaid portion of it. I think that's probably anything that we can do to maximize Medicaid, I'm always fully supportive. So I think, Dr. O, did you have a question?
Yeah, just a quick one. Thank you, Dean, for your presentation. And I also appreciate your bringing up some of the creative policies in other jurisdictions. So, and your offer to share some examples of the states that are doing the Medicaid reimbursement. So when you share that, if you could share examples of some of the other policies that you mentioned that other jurisdictions are doing, so that we have some templates to work from, that would be great.
Absolutely. I'm glad you have a chance to look at that, and there's some interest there. I think it can impact a lot of folks for sure.
Sounds great. I don't think we have any other questions, so we thank you, of course. And then, as always, we welcome your faculty recommendations on how to improve the built environment, which was the theme of today's meeting. So we'll go ahead and close this agenda item, and then we'll move on to our last agenda item, which is public comment. So at this time, again, public comment will be limited to 2 minutes. We will go ahead and begin here in Carson City for anyone that would be interested. Seeing none, BPS, is there anyone virtually looking to provide public comment at this time?
Thank you, Chair. If you would like to participate in public comment, please press *9 now to take your place in the queue. Caller with the last 3 digits of 746, please press *6 to unmute yourself. Again, caller with the last 3 digits of 746, please press *6 to unmute yourself. Thank you. Please continue.
Hello, everyone. My name is Kendra Edwards, and I'm the new Government Relations Director at the American Heart Association. I just wanted to let everyone know the AHA has been a really strong supporter of the Complete Street policy, advocating for creation of livable communities that provide equity, safety, public health, and also while reducing transportation costs and traffic congestion. It's a priority for the AHA to assist each city in adopting a comprehensive Complete Streets policy, and that was all I wanted to add. Thank you.
Sir, you have no more callers wishing to participate at this time.
Thank you so much. We'll go ahead and close public comment. I want to thank our committee members for attending today, and of course to Chair Harris for agreeing to do this joint committee meeting. As you know, we'll be heading, our following meetings for both committees will be heading into work session, and so we encourage folks to reach out to us as we work diligently through this process. So thank you so much, and the meeting's now adjourned.